Bismillah.
MashaAllah. Alhamdulillahi Rabbil Alameen wa salatu wa salam la Sayyid al Mursaleen amma ba'd fa'udhu billahi minash shaitanir rajeem. Bismillah ar-Rahman ar-Rahim. Salatu wa salam alayka ya Rasulallah. Salatu wa salam alayka ya Habib Allah. Inna Allah wa malaikatu yusalluna ala nabi. Ya ayyuhalladhina amanu sallu alayhi wa sallimu taslima. Allahumma salli ala Sayyidina Mawlana Muhammad barik wa salli alayhi. Alhamdulillah, after praising God Almighty and sending salutations upon the beloved of Allah, the holy, messenger, the Prophet Muhammad, sallallahu ta'ala alayhi wasallam, my dear respected brothers and sisters and our guests, assalamu alaikum wa rahmatullahi wa barakatuh. May peace and blessings be upon you all. And thank you very much for joining us. And today's our topic is about the vaccine and COVID. That there is some misconceptions, misunderstandings, lack of communication, whatever you could call it, conspiracy theories, whatever is the issue we need to remove about the importance of vaccine we're going to discuss, and also about surrounding around COVID as well. So after this, we start our program on Meem Madaat Welfare YouTube channel. And thank you for joining us, our guests as well. And before we go to our guests, we're going to start by recitation of the Holy Quran. Can everyone hear me?
Yes.
Okay, that's good. MashaAllah. Okay, so I'll recite the portion of the Holy Quran. It's a prayer. Those obviously we will have non-Muslim brothers with us as well and sisters. So therefore, I will just explain this. This is a prayer of the opening of the Holy Quran, and we'll translate into English as well. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Ameen. All praise is for Allah, the Almighty God, the Lord of all the worlds. Ar-Rahman Ar-Rahim, He is the utmost kind and the ever merciful. Maliki Yawmiddin, Master of Day of Judgment. Iyaka na'budu wa iyaka nasta'in. O God, you alone we worship and you alone we seek for help. Ihdina as-sirat al-mustaqim, guide us upon the straight path. Sirat al-ladhina an'amta alayhim, ghayr al-maghdubi alayhim wa ad-dallin. Amin. The path of those whom you have favored and of those who earned your anger or gone astray. Amin. So that is a prayer which is the opening chapter of the Holy Quran. Here, God Almighty is introducing Himself to His creation, that He is the most merciful, the most kind, and we should turn to Him to help and for worship. Of course, people of different faiths, this is a platform of tolerance. We're a country of community cohesion, a racial harmony, and we thrive in our community upon this tolerance and respect for each other. So as Meem Madaat Welfare, and it's an organization, just as a brief introduction before we start, the Meem Madaat Welfare Organization started about 3 years ago, and it started with just group of family and friends from UK, Preston, and then further afield, family and friends from Manchester and other towns took part in it, and people from Pakistan as well, and other countries. So basically what the aim of this group was to work with other global charities and small community organizations such as Deep Dell Community Association and Neighborhood Watch, and work with them on common goals such as relieving poverty, helping the poor and the needy, providing medical health care to the poor and the needy in the third world countries, clean water projects, orphan charities, and supporting all the charities in the world, and even in local Preston, Salvation Army, Noor Food Bank, Deep Dell Community Association, food parcels being delivered locally. So that is the aim of Meem Madaat Welfare, and its introduction is Meem Madaat Welfare and a helping hand through life. And that is the purpose of our organization. And with it, with the lockdown happening, then we wanted to bring some uh, awareness to our community, because unfortunately the mosques and the places of faith and schools and other means of communication had been basically reduced. And so therefore Meem Madaat Welfare started their own YouTube channel, which you are on today. So once again, thank you very much for our guests for joining us on the topic, removing myths, informing, giving the facts and removing myths about the vaccine, and talking about a discussion about COVID and how we can help overall as a community to rid us of this COVID and the pandemic, and how we can reach to the light at the end of the tunnel. And one of them ways is we are grateful that it is the vaccine. So we're going to talk about that. So before we have the other guests who are going to join us, like I said, today we are lucky to have Councillor Frank with us, County Councillor Frank, and we're lucky to have Dr. Bilal from Blackpool Hospital, and we've got Councillor Zafar, the Deepdale Ward Councillor, who has been striving and working hard, as well as with the other councillors, to get the information out there at all. Recently, they were with us on our knife awareness program. So we thank them to join us and supporting us on especially on a Sunday when people normally spend that time with their families. Thank you very much. And we've got our translator who did our translation, with the community. Vasic, he works with the PNE and other organizations, and they translate for the Romanian community. And hopefully from now on, we're going to try to get people, because we work with our Polish community and the Romanian community, and also we work with the Kurdish. So all these minorities communities who have joined us and become has made Preston a home, or UK as a home for themselves. So they are our community. So we need to get them involved as well. And that is one of the aims of Meem Madaat Welfare and Deepdale Community Association. So thank you very much for our public who supports us on these events and listens to us and sends in questions. And we are grateful for that. So Alhamdulillah, मुख्तसरन आप जो उर्दू सुनने वाले हजरात हैं, कि आपसे यही गुजारिश है कि हम कोशिश कर रहे हैं कि ये वैक्सीन का जितना भी कोई मिसअंडरस्टैंडिंग है या इसमें कोई शक शुबा है कि हमारे उलिमा क्या कह रहे हैं, हमारे डॉक्टर क्या कह रहे हैं, तो इसके मौजू में हमने ये प्रोग्राम रखा। तो इसमें माशाल्लाह हमारे डॉक्टर भी हैं, और उसके अलावा हमारे काउंटी काउंसलर फ्रैंक भी हैं, और काउंसलर जफर कुपलन भी हैं, और इसमें हमारा इमाम साहब भी आएंगे। हमारे इमाम साहब इमाम अब्दुल रसूल अलवी साहब रजा मस्जिद के प्रेस्टन के इमाम हैं, तो वो भी ज्वाइन करेंगे। तो उसके साथ साथ शेख सलीम साहब नूरानी एजुकेशन सेंटर के जो फाउंडिंग मेंबर है वो भी ज्वाइन करेंगे। तो इंशाअल्लाह हमारी कोशिश होगी उर्दू, गुजराती और रोमानिया, और उसके साथ साथ पंजाबी में भी मुख्तसरन मैसेज दिया जाएगा इंशाअल्लाह अज़ वजल, और गुजराती में भी इंशाअल्लाह। एंड जो बीमार हैं उनके लिए भी दुआ भी होगी आखिर में, और जो इस दुनिया से चल बसे हैं उनके लिए भी इंशाअल्लाह दुआ होगी, और उनकी फैमिली के लिए भी। तो इंशाअल्लाह waiting for our Dr. Sabs here as well. MashaAllah, Dr. Zahadeen has joined us as well from Blackpool Hospital. Jazakallah khairan, Dr. Sab, for joining us. So, inshallah, what we're going to do is we're going to start off with asking some questions to the both doctors. So I request Shoaib, if you can just put on Dr. Zahadeen on the main screen, and also Dr. Bilal, and myself and Wasi will obviously translate for us. So first questions, it's going to be based on I've already explained that anyway. So first of all, Dr. Saab, I'll speak to Dr. Bilal, that if you can explain the importance of this vaccine. I know we've been hearing from the government, we've been hearing from medical staff, but just to summarize the importance of the vaccine, whichever vaccine it is, and how important it is to us to support this the rolling out of vaccine, and also how important is it to ending the pandemic?
Yeah. Jazakallah, thanks a lot for the invite to discuss this, Brother Kamran.
You're welcome.
I think it's very, very important that people realize, the importance of the vaccine at a really wide level. Now, we've seen that we've been through this sort of quite severe second wave, which has really hit the community very hard, far harder this time round than around sort of April, May time. We found hospitals have been very, very busy, and they've really been struggling over the last few weeks. And the importance of the vaccine is one to sort of save lives, so particularly the lives of those that are vulnerable and at increased risk. And it's really important to bear in mind that there's this misconception that COVID really only affects the very elderly, or COVID only affects those with multiple sort of health problems. But all of us have seen within our community people really passing away from this world relatively young, without much in the way of other serious illnesses. So there is a disproportionate effect upon people from our community as well. And it's important to bear this in mind. So one, it will help to save lives. It's going to help save the strain on the health service. And thirdly, and quite importantly, it will be a means to hopefully, inshallah, bring an end to this pandemic. So I think particularly if you're invited to take the vaccine, and at the moment, you're invited to take the vaccine if you fall under high risk category, or if you are elderly, or if you are in the healthcare profession, or if you're in any profession that you're at increased risk, then in that scenario, I would advise you to take up the offer and to go ahead and take the vaccine.
Can I?
We can't hear you, Brother Kamran.
Sorry, Wasi, if you can translate that, please. Just summarize the importance of the vaccine, as Dr. Sabar.
Bună seara! După cum s-au prezentat fiecare, am să trec direct la întrebări. Da? Avem un doctor aici care el specifică importanța vaccinului. Vreau să spună că valul care a fost prima dată nu se compară cu valul al doilea. Este mult mai grav, toată lumea este într-un fel panicată și toată lumea dorește ca totul să se termine sau să se sfârșească cu bine. Cel mai mult sunt cei vulnerabili. În special, este o concepție foarte greșită că acest cum se spune, virus îi afectează numai pe cei bătrâni. Dar nu este adevărat. Îi afectează pe toți. Chiar și pe bătrâni, chiar și pe cei tineri. Avem de asemenea numere foarte mulți de cei care au trecut care au murit și care sunt destul de tineri. De asemenea, cei care lucrează în profesii, în spitale și sunt expuși la acest risc, ceea ce sfătuiesc eu este foarte bine ca să ia această oportunitate, acest vaccin, care, bineînțeles, îi va proteja pe ei, dar, bineînțeles, și pe ceilalți care sunt aproape de ei.
Thank you. Thank you very much for that, Wasi. Dr. Ziauddin Khan, and you are obviously a consultant at the Blackpool Hospital as well. So on the same topic, obviously, if you can explain that slightly in Urdu, and if you want to add something in English, that'll be great as well, what Dr. Bilal said about the importance of the vaccine and how it will help cope with the NHS, will help cope that and end the pandemic as well. Dr. Ziauddin, I think your mic is muted. Can you unmute your mic? I think... is
it better now?
That's it. We can hear you now. So if you can start with that one.
Thanks very much. Jazakallah khair. ये वैक्सीनेशन जो है ये किसी और वैक्सीनेशन की तरह आपको एक एक्स्ट्रा प्रोटेक्शन प्रोवाइड करती है और जिस तरह आप फ्लू की वैक्सीन लेती हैं या पहले जमाने में स्मॉल पॉक्स और इसके अलावा टाइफाइड वगैरह वैक्सीन होते थे, इस तरह ये भी एक वैक्सीनेशन है। इसके बारे में जो बहुत सारे मिथ्स हैं जो कि फर्दर हम डिस्कस करेंगे, लेकिन इसके लेने में कोई नुकसान नहीं है, लेकिन इसको ना लेने में बहुत सारे नुकसानात हैं। मतलब ये कि इफ यू डोंट टेक इट you will suffer with lot of harms, but if you take it you will be having a lot of benefits with it. और जिस बहुत important चीज है और इसके अंदर जो टेकअप रेट है वो एशियन पॉपुलेशन के अंदर इट्स अबाउट 54 to 55% है, जबकि नॉर्मल जो कॉकेशियन पॉपुलेशन इट इज अबाउट 79%। तो आप ये अंदाजा कर सकते हैं कि हमारे अंदर कुछ रीजंस हैं जिसकी वजह से हम थोड़ा सा अवॉइड कर रहे हैं इसको लेने से। हालांकि इसके अंदर कोई ऐसी चीज अब तक सामने नहीं आई है, और इसको अगर आप जाके मुख्तलिफ जगहों पे देखें, खास तौर पर अगर आप ब्रिटिश इस्लामिक मेडिकल एसोसिएशन की साइट पे चेक करें तो आपको अंदाजा होगा कि इसमें कोई भी ऐसी चीज नहीं है जो कि इस्लाम के खिलाफ हो या इस्लाम हमारी बेसिक टीचिंग्स के खिलाफ हो। तो मैं फर्दर इसको एक्सप्लेन कर दूंगा जैसे जैसे बात आगे बढ़ेगी, लेकिन ये जो शुरू में इनकरेजमेंट है वो ये कि मैं खुद भी लगा चुका हूँ इस वैक्सीनेशन को, मैं पहले सफर भी कर चुका हूँ इससे, तो मुझे इसके बारे में एक फेयर आइडिया है कि ये चीज जो है वो हमारे लिए फायदेमंद होगी, नुकसानदेह नहीं हो।
अच्छा डॉक्टर साहब, अब एक इसके सवाल में आता है कि यानी कि ये थोड़ी कंफ्यूजन है कि इसमें साइड इफेक्ट्स बहुत होते हैं, मगर आप डॉक्टर हैं, आप हॉस्पिटल में वर्क करते हैं, तो आपने देखा होगा कि तकरीबन बहुत ज़्यादा माशाल्लाह वैक्सीन हो चुका है। तो आपने किस लेवल पर देखा है जिन्होंने वैक्सीन, आपने से कहा आपने भी लगाया है, डॉक्टर बिलाल you said you've had the vaccine as well, I've had the vaccine as well, so basically on majority basis आप क्या समझते हैं कि जिन्होंने लगाया है आपके हॉस्पिटल में कितनी एडमिशन हुई है जिनकी साइड इफेक्ट्स हुई है, डॉक्टर ज़ियाउद्दीन साहब?
देखिए, जहाँ तक सवाल है, किसी भी वैक्सीनेशन के साथ इसका एक इफेक्ट होता है। मैंने जब इसको लगाया था तो मुझे सबसे पहले बाजू में दर्द शुरू हुआ था जिस आर्म में लगा था। उसके बाद थोड़ा सा फीलिंग ऑफ अनवेलनेस थी इन अ वे कि मुझे हल्की हल्की जो है वो जिस्म जैसे टूटा टूटा सा होता है, यू आर फीलिंग अंडर द वेदर, यू आर हैविंग सम लाइक फीलिंग ऑफ फ्लू लाइक सिम्टम्स, बट दैट डजंट मीन दैट यू हैव टू बी हॉस्पिटलाइज्ड फॉर दैट। आई टुक सम पैरासिटामोल और उसके बाद एक दिन के बाद मैं आई वाज सेटल डाउन विद दैट। यूजुअली फॉर 24 to 48 आवर्स, 24 घंटे से 48 घंटे के दरमियान आपको सिम्टम्स होते हैं, लेकिन ये सिम्टम्स is not something which is unheard of. It is a very common side effects of the vaccination in any vaccination, and I think that should not discourage us to take it, because if you get the disease itself, the problem with the disease is much more than this side effects.
Definitely. Dr. Bilal, if you could just elaborate just in English, because obviously a lot of people think there's got a misconception that, there's a lot of side effects, and obviously you're working in the hospital. How much masses have come with side effects to you, or people who you know in the local community who had the vaccine? Have you got any feedback in that way?
Yeah. So pretty much, most of my team have been vaccinated in our department, and the people have had a sore arm, a bit flu-like afterwards, but there's been no serious side effects in people that I know who've had it. Now we have to bear in mind that to date, 10 million people in the UK have had the first dose of vaccine, and globally 128 million people have had the vaccine as well, right? So you're looking at really huge numbers, and in them huge numbers, minor side effects are to be expected. And in fact, if you get the minor side effects, that's a good, because it shows that actually your body is producing, the reaction, the response that's needed. So when you do actually get exposed to the real infection, your body will be able to fight it. So, any concerns about serious side effects, I think they're not there. And, with the huge numbers that have been vaccinated so far, it appears to be a safe vaccine for people to take.
Okay. Vasi, if you can just translate that, please, about the side effects.
Vă rog foarte mult, doctor Bilal, puteți să explicați dumneavoastră, pentru că dumneavoastră ați lucrat în spital și știți situația mult mai în detaliu. Da, eu lucrez în spital, echipa mea din spital a fost vaccinată aproape toată. Bineînțeles că sunt 10 milioane de oameni care au luat vaccinul, prima serie de vaccin, iar 128 de milioane de oameni în toată lumea care au fost vaccinați. Bineînțeles, se vorbesc despre efectele acestea secundare. Nu, dacă ești expus la boală, bineînțeles, lupți, dar efecte secundare nu sunt alte efecte decât cele pe care se pot avea atunci la orice vaccin. De exemplu, la un vaccin de vărsa de vânt sau de răceală sau de altceva, sunt aceleași efecte, dar efecte secundare prea mari chiar nu s-au întâlnit, cel puțin în area mea unde am lucrat, unde colegii au fost vaccinați.
Okay, thank you very much for that. Dr. Bilal, just quickly, just summarize. Obviously, a lot of our listeners who speak Gujarati, they speak Urdu as well. But if you can just give us a short message in the importance, and obviously what you just said, that this is a misconception that side effects are masses and people are unfortunately there's rumors spreading some people have died, and you just said 120 million people have had the vaccine worldwide and over 10 million in UK. And Dr. Ziauddin explained that the side effects in terms of not having it is mass death. Over 100,000 people have died in the UK alone. So if you can just give a short message, and then I'll bring on one of the respected scholars to talk about this subject.
So assalamu alaikum. A vaccine barani under khasabara loke mane puchhut ke doctor sahab ki a vaccine lewu ke nahi lewu અને મેમને એવો જવાબ દીધો કે આ વેક્સિન જે છે એ તમે રિસ્કની અંદર તમારે હાઈ રિસ્ક હોય તો જરૂર લેવાનું તમે લઈ લેવું જોઈએ તમને કેમ કે એનું જે પ્રોટેક્શન જે છે એ સારું પ્રોટેક્શન છે અને લોકોને ફિકર છે કે વેક્સિન લીધા પછી શું થશે એના સાઇડ ઇફેક્ટ શું છે અને પાછા આપણા કમ્યુનિટી અંદર એ બધી બુરી વાતો ચાલે જ કે તમે વેક્સિન લેશો કે તમને આવું થઈ જશે કે તેવું થઈ જશે કે એની અંદર કઈ વસ્તુ નાખેલું છે કે તમને ટ્રેક કરશે એવું બધું વાતો લોકો ફેલાવે જ પણ હકીકત એ છે કે આ વેક્સિન જે છે એ સેફ વેક્સિન છે ઓલરેડી યુકેની અંદર 10 મિલિયન લોકોને દઈ દીધું છે અને કઈ સિરિયસ ઇફેક્ટ નથી આવ્યા અને આખા વર્લ્ડની અંદર મિલિયનો લોકોને ઓલરેડી ડોઝ દઈ દીધો છે એટલે તમારું ઇન્વિટેશન આવે વેક્સિન દખે એનો મતલબ કે તમારે ઈધર ઉંમર વધારે હોય કે તમારી પાસે રિસ્ક ફેક્ટર્સ હોય તો પછી એ ઇન્વિટેશનનો કાગળ આવશે તો તમારે અપોઇન્ટમેન્ટ બનાવીને બિસ્મિલ્લાહ બોલીને એ વેક્સિન લઈ લેવાનું હવે એ મારું એડવાઇસ છે ત્યાંથી બીજી બધી જે વાતો જે છે એને ફોલો નહીં કરવાનો અને એ જે જરૂરી જે વાત છે કે આ જે બધો જે વાતો આવે એ આપણને એ વાતો ફેલાવવાની હોય નહીં કેમ કે જેવી કઈ એવું જે ન્યૂઝ અમારી પાસે આવે એ પહેલું ચેક કરવાનું કે એ સાચું છે કે નહીં અને એ બહુ મોટો પ્રોબ્લેમ છે કે ગમે તે વોટ્સએપ કે એની ઉપર આવે તો આપણે તરત જઈને ફોરવર્ડ કરી દે અને એને પછી લીધે એ પ્રોબ્લેમ આવે brother Kamran, I've just added on to there that there's a lot of misconceptions going on in the community, often from social media. I said it's really important that we don't become a part of spreading false news. And if we get something like this, then it's important for us to verify it without just forwarding it on. Because the important thing is a lot of people who are at highest risk are the elderly and the vulnerable, and the people who are sort of very much anti-vaccine seem to be the younger generation. And as a consequence of this, when the letter will come, the parents or grandparents might ask the children or grandchildren, and they will follow the advice. They'll look, I'm not sure about the vaccine. And if people keep on spreading these sort of false stories, then you can actually put people off who need to take the vaccine, who are actually those that are at the highest risk.
Well, thank you very much for that, Dr. Saab. मैं मुख्तसरन पंजाबी विच भी तुहानू दस छोड़ना कि डॉक्टर साहब ने भी अभी हुण सानू ये समझाया कि देखो कि ये वैक्सीन जो है ना ये इतना इंपॉर्टेंट है कि इस पैंडेमिक को खत्म करने में भी अल्लाह की एक नेमत है सानू अल्लाह ने अता फरमाई है कि शिफा अल्लाह की तरफों है मगर साथ ही साथ वसीला बना है कि मेडिसिन के जरिए तो इस वास्ते इस्लाम भी सानू ये दसदा मैसेज देंदा है कि देखो जिथे जरूरियात है इंसानियत जान बचानी अपनी जान बचानी उत्थे तुहाडे उपर एक किस्म दा ये फर्ज है ये तुहाडा हक है तुहाडा फर्ज है तुसी इस विच हाथ बटाओ वैक्सीन लो एक तुहाडे पर ये खुशकिस्मती है कि कितने ममालिक ने जिथे नहीं सानू मिल सकता सानू जेडे गरीब होरवे ने उन्हां पर नहीं ये फैसिलिटी मिल रही सानू मिल रही है तो बेसिकली इस चीज नु तुसी अपनाओ तो इहदे विच देखो डॉक्टर साहब ने आख्या 10 मिलियन से ज्यादा हजरात ने लवा लिया इस यूके विच लोन 128 मिलियन भी ज्यादा वर्ल्ड वाइड तो जेडे साइड इफेक्ट्स होए ने मुख्तसरन होए ने तो वो तो पैरासिटामोल दा भी एक साइड इफेक्ट्स हो सकता है तो इस वास्ते इस चीज नु अपनाओ बहुत जरूरी है इस्लाम हर वेले जदीद साइंस विच भी मेडिसिन विच भी अपने दीन विच भी साडा इस तरीका है तो इस वास्ते हर वेले हाथ बिठाया असी कुर्बानियां दित्तियां ने इन्ना लॉकडाउन दे जरिए भी तो हुन साडा काम बनदा है इस चीज नु भी अपनाइए जज़ाकुल्लाह खैरन इंशाअल्लाह if now we're going to bring on Dr. Satwi. Is Dr. Satwi with us? Shoaib, if you can bring on Dr. Satwi, and what will happen, Bilal, or one of you will go on the backstage and then we'll bring one of the speakers next. So Shoaib, if one of the speakers you can put on, you can put Dr. Ziauddin in the background for a minute and basically put on, if Imam Sheikh Salim Shab is with us, put them on first, please. MashaAllah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Sheikh, Jazakallah khairan for joining us. And I'm sure you've been listening to the talk, and mashallah, our doctors have elaborated the importance and also the need of this vaccine and how important it is, and to shun misconceptions. And Dr. San made a very good point that basically verify. Our scholars have been saying this for a very long time. I'm sure it's a teaching of Islam as well, that verify before you pass on the message or knowledge. So first of all, Sheikh, I know you're rushing, you need to go to another event, but if you can elaborate the importance of health and how important it is to us to maintain our health and hygiene, and also the importance of medicine in Islam as well. And then we'll take another question for you as well.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome everybody. First of all, thank you very much for letting me on this show and also on such a very important topic. I'm going to refer back to what Dr. Bilal said, really, and is that the misconceptions of social media, etc. We are living in a very difficult times at the moment, and that is that everybody has access to everything. And when I say everything, it means good and bad. And the problem is that bad news travels faster than good news, and that's always a fact. That's why we'll always see bad news on news first, because it brings people's attention. When it comes to health, I think we're all aware that Islam has emphasized a massive amount of importance on us looking after our health, us looking after our well-being, and looking after others around us as well. And the Prophet ﷺ has also said that everything has a cure except for death. The question is, over a period of time, and as the human being has become more and more involved in science, we've found cure to things which were normal expected deaths many years ago. I mean, if you talk to our elderly generation, they'll tell you that TB was a killer in the 60s and the 70s. Today it's treated more like a headache, and the fact of that is because of the advancements of medicine. And the medicine has always been around. The Prophet ﷺ himself instructed medicine. If you read the book by Imam Suyuti, Tibb Nabi, is the healing of the Prophet, and it was around how honey can cure certain things, how fig can cure certain things, etc., etc. So medication is a very, very important part. And the sad thing really is that we will take medication for things where we have to. For examfall, if you want to go for Umrah, you'll take meningitis, no problem. There'll be no questions asked. There will be no issues as to whether it's got something in there, it'll make you fall ill, or etc., etc. We are now living in a global pandemic. Whether you accept that or not, that is the fact. Sadly, today we have buried some of our members of our community, not elderly ones, elderly and people even younger than me. And it breaks my heart, and I'm sure it does with the medical staff as well, that we have to lose people for this nasty, evil disease. Yes, normally medication takes a process, and I'm sure the doctor Sab will tell you it's a process of over a period of time when it's certified, etc. But we're not in a normal situation at the moment. Therefore, things have to be superseded, things have to be passed to ensure that the health of the people. The muftis and the ulama have looked at this medication, and I have seen fatwa after fatwas to say that perfectly well and healthy, perfectly allowable for people to take this vaccination. This vaccination doesn't include any ingredients which are haram, and even, let me tell you, even if it included things like alcohol, etc., even then, and this just gives you an answer of how important medication is, that the scholars have said that you can use alcohol for medication purposes, i.e. to heal, where you have no other option. In fact, the scholars have also said that if you were lost in a jungle and the only thing you had to eat was swine meat, you're allowed to eat the swine meat to save your life. Now, in this particular vaccination, there isn't anything, just to give you that peace of mind. And therefore, those people who are spreading these rumors are, sadly, they are rumors, they're incorrect rumors. And the Prophet ﷺ said, when you hear something, make sure you verify it. And also, it is sufficient for someone to be called a liar who passes information on without verifying it. So in other words, you yourself, if you check something, oh, look at this, let me pass it on to 20 different people, 2 of them people choose to take that on board and it's a lie, you have just spread a lie. And the most important thing is that the Quran tells us, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. It says, ask those if you do not know. So those with knowledge, ask them if you, and this knowledge specifically, by the way, doesn't mean Islamic knowledge. Yes, from an Islamic perspective, if you've got Islamic questions, ask the scholars. If you've got medicine or medical questions, ask the medical staff. And that's why there was a sheikh, just a very quickly, a sheikh in Syria who went into Syria many years ago and was spreading the deen, and someone came up to him and said that I understand that the Quran has the answer to everything. And he said, yes, it does. He said, well, in that case, tell me, how much wheat do I need to basically grow on my land, which will then triple? So he said, okay. He then called another person and he asked the question, how much wheat would he need? What would happen? And the person answered the question, who was a farmer for 30-40 years. He turned around and said, there you go, that's your answer. He said, that's not in the Quran. He said, no, in the Quran it says, ask those who know if you do not know. So he said, that's exactly what I've done. I've asked the person, I didn't know the answer to that, so I asked the person who knew the answer to that. So in that situation, go to the medical staff. We've got doctors on here of the, and Alhamdulillah, I know Dr. Bilal personally as well. And, we got practicing doctors, we got people who understand the deen as well as the medical practice. And the fact of the matter is that it is absolutely critical that our community gets vaccinated as soon as you are invited. And I think, Brother Kamran, what you said initially in Punjabi, although my Punjabi isn't the greatest, the fact of the matter is we are very lucky to be in a society where you are getting free vaccination. There are people, sadly, who are in the third world who aren't even on the list yet because the countries haven't been able to secure that vaccination. And then when they will probably have to pay an arm and a leg to get that vaccinated. This is not a conspiracy theory for Bill Gates to make millions and billions of pounds, because the fact of the matter is trillions have been lost in the economy. Okay, no one can recover that. And the fact of the matter is that you as an individual must go. It's not going to cost you any money. There is look, at the end of the day, shifa and cure comes from Allah. We all know that. Okay. However, we also have a responsibility to try and find a cure through a means. And the means in this situation is the vaccine. I mean, I've taken my mother to the vaccine straight away, and I recommend it to anybody. Okay, the vaccine is being developed, and the irony is that the founders, and correct me, Dr. Bilal, if I'm wrong, that the founders were Muslim, actually in Turkey, of Turkish origin, who have actually found the medication. So we should be proud. As a Muslim community, we should be proud that, within ourselves. Now, it was the Ottomans that used to find a lot of the cures in the past anyway, right? A lot of research was given through medication through the Ottomans at the time, who were the world leaders at the time. So my message to everybody, all the fatwas by all the different schools of thought are telling you that there is nothing wrong with this vaccine. It's safe to do so. Go and take the vaccine. Don't listen to rumors and misconceptions and fearful of, I might get slightly ill, because the other option is death. Okay, yeah. The other option is death. And go and ask those families who have lost their loved ones how much they would have tried to get a vaccine if they could have done prior to that. Okay, so do that for yourself, for the people around you, for the wider community, and for the whole community, because sooner or later everyone needs to be vaccinated to ensure that we go back to normal way of life. Okay, and that's the reality. Whether you like it or not, that's the reality that you will. And if you want to travel abroad, if you want to go for Umrah, and they've already Saudi have already announced it anyway. Although Umrah is not open till after Ramadan, but they've already announced anyone traveling to the Kingdom of Saudi will need to have proof of a vaccination. Okay, so how long are you going to delay it for? Right, get it now whilst you've got the option, and inshallah, if Allah wills, you will be protected. Then you put your trust in Allah.
Sheikh, I know you're rushing to go to another event, but a commitment. But can you मुख्तसरन आप गुजराती में तो एक अल्फाज बोल दे कि ये हलाल है और इसको
हाँ बिल्कुल તો તમને ગુજરાતીમાં સમજાઈ દો કે આ વેક્સિન જે છે એ હલાલ છે એની અંદર કોઈ ઇન્ગ્રેડિયન્ટ્સ એવા નથી કે જે મુસલમાન માટે જાયઝ નથી બલકે બધા જાયઝ છે અને એટલા લગન છે કે આપણા ઇસ્લામ માટે એવું છે કે અગર કોઈ શરાબી દવાના તौर પર ઇસ્તેમાલ કરવામાં આવે તો એની બી ઓલમાએ ઇજાઝત આપેલી છે પણ અહીંયા તો તેનો એ નથી અહીંયા બધું અમુક લોકોનું કહેવું એવું છે કે પેલું ફ્લુ આપણે નેઝલ ફ્લૂની અંદર સુવરનો થોડો હિસ્સો આવે છોકરાને દેવામાં આવે તેવું આ છે પણ એવું નથી એ તો નેઝલ સ્પ્રેના બારામાં ફતવો હતો ઇન્જેક્શનના બારામાં ફતવો નથી ઇન્જેક્શનના ફ્લૂના બારામાં નથી અને આ વેક્સિનના બારામાં નથી બધા જ ફતવા એવા જ છે કે ભાઈ આ વસ્તુ જાયઝ છે તમારે લઈ શકો અને તમારે લેવું જોઈએ અગર તમારા પાસે એ NHSના ઇન્વિટેશન આવે તો જરૂર જો અને આપણે હા અમુક લોકો કહેવું છે કે મોત ને જિંદગી તો અલ્લાહના હાથમાં છે બેશક આપણો તો ઈમાન છે કે મોત ને જિંદગી તો અલ્લાહના હાથમાં છે પણ અલ્લાહ તાલાએ આપણને શિફાના જરિયાઓ આપેલા છે તો એ આપણે ઇસ્તેમાલ કરવાના જિંદગી બચાવવી બી ફરજ છે બીકોઝ તમારી જિંદગી બચશે તો તમે અલ્લાહની ઇબાદત કરશો નહીં અને તમે અલ્લાહની યાદ કરશો નહીં જિંદગી બચાવવાનો બી ફરજ છે તો આપણે કોશિશ એવી કરવાની પછી અલ્લાહ પર છોડ દેવાનું તો તમામ ભાઈઓને અને બહેનોને મારી રિક્વેસ્ટ છે કે તમારો ઇન્વિટેશન આવે તો જરૂર તમે જો અને બીજા બધી જૂઠ્યો વાતો ન માનો કે જે ઓનલાઈન આવી રહેલી છે બધો વગન દલીલની વાતો છે અને એ વાસ્તવને નહીં માનવાની અને આ વસ્તુ પર તમે inshallah tawajjuh abjo just wanted to say brother Kamran which I forgot to mention in my initial introduction and that is that some people have the misconception that it contains pork. Yeah. Okay, and the fact of the matter is, and they get that misconception from the nasal flu spray that some of the children were given at school. Okay, that is totally different. That's a nasal spray, and the scholars have said no because it's a preventative measure. This is not a nasal; it's an injection. The flu injection doesn't have any ingredients of pork, and neither does this. This has no ingredients of pork whatsoever in this injection, and it is perfectly permissible by all scholars to take. So please don't go off that misconception. That is totally different, and it doesn't apply here.
Jazakallah khairan, Sheikh, for coming and joining us. And inshallah, hopefully in future programs, you will be joining us.
Inshallah. Jazakallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Wasi, I know this is a detailed, why I didn't take, you to come into the translation. The one aspect, obviously, the scholar is giving an Islamic perspective. What I would like to use, much of it is for social benefit as well, is all faiths have the same kind of, I've spoken to other faith leaders, unfortunately, due to the shortage of time, we couldn't get everyone on, but I've spoken to other faith leaders and they're all backing this, whether it's Christianity, whether it's Judaism, whether it's people of no faith, people who believe in science or have no faith, or whatever their beliefs are. So basically, rather than translating what our scholar said, if you could briefly add to a little bit, because conscious of time as well, about the Christianity, as you are a practicing Christian, and your community has told you about this vaccine, just how similar it is to the message what our scholar gave of Islam, and what is the message of you would portray in that same line.
Bineînțeles. Deci m-a rugat ca să spun totuși că a fost o părere islamică ceea ce domnul a prezentat aici, dar nu este prea departe de cea creștinească. Deci trebuie, în primul rând, comunitatea, oriunde ne aflăm, trebuie să avem grijă de sănătate, igiena, medicina, medicamentele, pastile, tot ce folosim au importanță în viața noastră. Bineînțeles, este aceste concepții greșite care tot apar în media, peste tot, referitor la anumite vorbe și cuvinte referitor la vaccinul acesta. Bineînțeles, ca orice boală, de exemplu ca o răceală sau să spunem ca vărsa de vânt, dintotdeauna oamenii au fost vaccinați. Trăim într-o societate nu prea acum bombardată cu toate informațiile astea din media. Bineînțeles că ca acum niciodată nu a fost atât de critic și toate informațiile astea pe care noi le luăm din mass media și de peste tot ne pot afecta. Este, bineînțeles, vaccinul acesta este foarte greu de înțeles pentru unii oameni. Unii spun conține alcool, alții spun că conțin, din punct de vedere cum a prezentat domnul la islam, conține porc, ceea ce ei nu acceptă și spun că nu. A făcut o comparație între spray nazal și alte vaccine și spune nu, vaccinul ăsta este în siguranță, nu conține așa ceva. Bineînțeles, vorbele zboară, atât din media, din vorbă în vorbă, de la prietenii, de la cei care, bineînțeles, iau contact cu acest vaccin, cei care lucrează în spitale și în alte locuri. Apoi a dat un exemplu ceva. Referitor, avem un doctor, a prezentat că avem doctor, avem oameni care lucrează în medicină și comunitatea, în primul rând, trebuie să fie în siguranță. Deci fiecare poate să acționeze cum consideră și dacă, bineînțeles, vrea să călătorească sau vrea să se întâlnească cu ceilalți, probabil o să ia varianta de vaccin. Dacă nu, este alegerea lui. Oh, we can't hear you. Camera.
I think he was on mute. Sorry. Yeah, thank you very much for that, Wasi, translation in Romania. Now we're very lucky to have our Director of Health and Wellbeing from the Lancashire County Council, Dr. Satwi, and it came at very short notice. We were grateful. Dr. Sab has been on many shows, on community events, Zoom program, on various other events, trying to update us, keep us updated about schools, about all aspects of what the pandemic has affected, all aspects of life. So I know, Dr. Sab, Dr. Sakhwi, you have to go. You got another commitment elsewhere, but thank you very much for joining us on Sunday. It surely shows this that our NHS and all our doctors are working 24 hours. Thank you very much for that. So we come straight to the point, Dr. Sakhwi, that basically how important is the vaccine, how much encouragement we need to do as all of us together, and basically if you can elaborate a little bit more what's in it, and basically how it affects people of different faiths as well. And if you can add a little bit about your various skills you have basically got in this field, and just elaborate on that. Thank you very much, Dr. Satwi.
Thank you. Good evening. First of all, many congratulations for the Deepdale Community Association for doing this. You're doing a great service to our community at this very much a critical time. So I'm very, very grateful for what you are doing, not just for community in Preston and Lancashire, but throughout the world. We are still in the middle of the pandemic. It has taken thousands and hundreds and thousands of lives, and also across the worldwide community as well. It is particularly more affecting Black, Asian, minority ethnic groups. And at the moment, the best thing we have to protect ourselves from severe disease and even death is the vaccine. It is actually great that the scientists have developed the vaccine in such a short span of time in any pandemic. And we are very, very grateful for this scientific development that is actually helping saving lives. So it is very, very important in the management of the pandemic. The second thing is this virus is brand new to humanity. So we have not got any pre-existing levels of immunity against this virus at all. And therefore, it makes it doubly important for the vaccine to be taken. And also, like you've already mentioned, and Dr. Bilal and Zaid Hussain have covered it very, very nicely before about the side effects and how safe it is to have this vaccine. And it is being given to everybody in the top 9 groups, the Joint Committee of Vaccination Immunization. At the moment, it is there for everybody over 70. And very soon, it will be available for everyone who has got who is above 50 years of age, which free in the UK, and the aim is the government is planning to give it by the month of May. So if we can all take it, we can prevent the number of viruses circulating in our community as well. That is a new finding that science is just has been finding out, that it is not only preventing severe disease and death, but there is a high likelihood that it is also preventing the transmission from one person to the other. And as we go through the next few months of the pandemic, this is the only thing that we can have to actually reduce the levels of the virus and get back to whatever the new normality is. So having the vaccine is very, very important in this stage of the pandemic to get life back to as normal as we can.
Thank you.
In terms,
sorry, just I wanted to, as I know you're rushing, you're going at 6:15. I know that, but there's a question. Some people are feeling that there's some kind of anti-Black Asian minority campaign to defame the image of these communities, that they're not taking the vaccine. Do you feel there's a government kind of anti-BAME campaign who's is defaming the image? Because what it is why I ask you this question, because somebody's forwarded this on our group from the Community Association, but also because there's this misconception that whilst Asians are not wanting the Black BAME community basically don't want the vaccine, but as far as I myself, working in the community, Dr. Bilal and many other scholars I've spoken to, and they all feel that that is a misconception. What do you think about that, Dr. Sakhtwi?
It is a misconception. Actually, we are very grateful in Lancashire and in the Northwest that thousands of people from the Asian community are coming forward for the vaccine. It is not the case that they are not coming forward for the vaccine. And also the examples that our own members of the community are coming forward, not only doctors, but people who've had the vaccine and people like yourselves and the scholars dispelling the myths. It is also true that people from South Asian background and Black and Asian minority ethnic groups, they are also in the front line as well. So it is important for us to protect our own self. When we are actually saving others, we need to be protected as well. And that is why it is important for us to have the vaccine. There is, we've got to, like you said, even the development of the vaccine itself has been contributed by people from the Muslim community. So it is to be done with a lot of pride as well.
You're here with us, Dr. Sakhtwi, so obviously you're doing a wonderful work as well. Another question there, because constitutes our time, I thought I might as well get these questions with you. Basically, there's a question that why do you feel that the death rate has been high or was high? Well, it's still high compared to New Zealand, third world countries like Pakistan and Dubai. That is compared to them countries is quite low. What is the reason? What do you feel?
Okay, before we compare other countries, only in a few months' time, when we have all the data to compare countries, we can be very sure. But it is also true that we have lost, like you said at the beginning, thousands of lives. There are a number of reasons. First, we are one of the few countries, part of the Europe has been the center of the pandemic for a long time. And also people who are higher, older people are more proportionately higher in Western countries than in Eastern part of the world. And also there is a likelihood of the weather playing its part in the spread of the virus. Particularly when it's cold, we tend to spend indoors, and with the virus is meant to spread or is known to spread faster indoors. So there's a number of things, but also people who are in the front line, and also people who are living in less well-to-do communities and not being able to afford to stay at home as well. They are having to work in the front line, and therefore they put themselves at risk of contracting this virus too. And these are all the factors that why we seem to have a lot more burden of the virus. But this is not over yet, and we can still prevent this getting further affecting our communities by taking all the precautions. And vaccines are main part of the protection, but we mustn't forget hand washing, face masks, social distancing and following the rules, because the virus is still much prevalent. Although it has come down in the last month and two, it is still very prevalent, and we need to get the levels as low as we possibly can so that the further deaths and further hospital admissions can be prevented.
Thank you. Can I just quickly go to Dr. Bilal on this one? Because this question is, there's a lot of misconception about this, that the Pfizer vaccine is not that good and the Oxford vaccine is better, so you should wait till that comes out. So Dr. Bilal, what do you have to say about that? And I'll come back to you on that as well, Dr. Sakfi.
So both the vaccines have been shown to be highly effective in the studies. They work slightly different. And I think the problem with the Pfizer, I say problem, is mainly to do with storage. So in a hospital I work at in Blackpool, they built this facility because it has to be stored at minus 70 degrees. And then once it's thawed out, you have to use it in a number of days. So it's more of a logistical problem. And the benefit of the Astra vaccine is that, a standard refrigeration will do. So logistically, it's far easier to vaccinate a large proportion of the population with the AstraZeneca vaccine. At the end of the day, they're all highly effective. They've all got, a very good safety profile, and whichever one you are invited to go and get, I would accept the invitation.
So really, Dr. Bilal, on this law, it's not the Oxford's gonna or the Pfizer, or it's not affecting people in different ways. It's basically just about storage, or like you said, it's more logistic than.
Well, there is a slightly different way that they work. So, for example, the Pfizer vaccine is there is an mRNA protein which goes in, and your body's machinery then manufactures the spike protein of the virus, and then your body creates the antibodies to it. So that works in that way, and the Astra works in a slightly different way. So there's slight different changes in mechanism, but the end result is the same, and the end result is providing safety to your body, and that if you were to get infected, you have far less risk of getting serious disease and death.
Mukhtasaran, Dr. Bilal, if you can elaborate that in Gujarati, I don't just keep it to the summary. So I think they'll get the message that, because ये हमारा misconception है कि वो आएगा तो वो use करेंगे, and certain days दे ये हो रहा है, वो हो रहा है.
अभी બંને vaccines છે, એક Pfizer નું બનાવેલું છે અને એક Astra નું બનાવેલું છે. પણ એવું કહેવા માંગુ છું કે એ બંને જે છે ને બંને બહુ સારા છે, અને જેવી કઈ તમારું કાગળ આવે ઇન્વિટેશન વેક્સિન લેવા દે, એ લોકો જે તમને ઓફર કરતા હોય એ બિસ્મિલ્લા બોલીને લઈ લેવાનું. એની અંદર કઈ બહુ મેજર ડિફરન્સ નથી બંનેની અંદર. જેવી રીતના કામ કરે સ્લાઇટ ડિફરન્સ એની અંદર છે, અને તમે સ્ટોરેજ કરવાનું એકને -70 degrees ની જરૂર હોય, અને બીજું નોર્મલ રેફ્રિજરેટર ની અંદર જાય. એ ખાસ ડિફરન્સ છે એની અંદર.
Just on that, we just received a question that these vaccines, are they going to help with the new strains which have been founded recently in Lancashire as well and all across the UK? Dr. Bilal?
I'm going to pass it on to Dr. Sakti this question.
Yeah,
No
pass on
problem.
to Dr. Sakti.
No problem, Dr. Bilal.
you,
First of all, just to add to what Dr. Bilal was saying, it is both the vaccines are aimed at the particular protein called the spike protein. So just there's a difference in the change in the mechanism of how they protect, but both are aimed at on that. And that nicely leads me on to this variant. These viruses change. It is normal for the viruses to change. Every year, flu virus change, and we develop new vaccines for that. But what we are currently facing, the various variants in the UK, they don't completely not protect against the vaccine. That is not the case. That's a myth. All vaccines have an effect. And even now, large-scale studies are still needed to actually understand fully what the impact of the variants on the vaccine is. With what we know, it is true that these vaccines are effective against the strains that are in circulation, but it is something that people are really, there's ongoing research to follow up on the effect of these vaccines. Even if the variants occur, it is not going to be the case that we will completely lose the impact of vaccines or the protection that the vaccines give. There may be a slight change, but it is not that it is not going to be any protection at all. And this is something that we are actively monitoring. And if the situation changes, there may be a need for a further dose like the flu vaccine later in the pandemic. But at the moment, if you are invited for the vaccine, this vaccine will give you significant protection against all the variants that we currently know of. So please don't be put off by the new variants in the vaccine. If you get an invitation, please go and get it. And also the difference between the Pfizer and Oxford AstraZeneca, the mechanisms may be different, but they are all aimed at the same part of the virus. And we are also facing issues with supplies. So don't wait for just one particular manufacturing of the vaccine, Oxford AstraZeneca or Pfizer. If you get that, you will again get the same one for the second dose. So don't postpone or wait for choosing between one of these vaccines. It's important to get it, like Dr. Bilal and others have said. If you get an invitation, please go and get it.
Okay, can we get Wasi? I know it's quite a detailed translation, but if you can keep it summarized to that, about the virus and about the vaccine, that both vaccines are fine, and the message is simple: go and get it. At any vaccine you get offered, you should get that. And the virus is obviously, like Dr. Sakhwi is explaining, that viruses are going to change, but up to what the research, the information they have, the vaccines, both types, or the third type vaccines, I'm sure, coming out as well, and they all aim at the same thing. Thank you.
Deci, Dr. Sakhwi a prezentat mai mult referitor la acest virus. În primul rând, a felicitat comunitatea că se ocupă de așa ceva, având în vedere că pandemia este încă în continuă, trebuie să fim recunoscători și să ne protejăm, și că dacă aveți posibilitatea să mergeți și să vă vaccinați, faceți-o, pentru că este o posibilitate, având în vedere că este și gratuit și se poate face foarte ușor. Alte țări poate că nu au posibilitatea asta. Bineînțeles, vaccinul acum a fost prezent pentru cei în vârstă de peste 70 de ani, este prezent acum și pentru cei în dată de peste 50 de ani. Cu cât putem să prevenim boala să apară în comunitatea noastră mult mai mult, deci vaccinul, dacă puteți să mergeți și să vă faceți vaccin, este foarte bine. Bineînțeles, a prezentat o diferență între aceste două vaccine, Pfizer și Astra. Diferența nu este foarte mare, bineînțeles că mecanismul și felul cum este depozitat poate că este diferit, dar având în vedere că toate vaccinurile astea nu fac decât să ajute împotriva acestei boli, puteți să, aveți posibilitatea, mergeți, vă vaccinați, este la atitudinea dumneavoastră.
Thank you very much. Now we're going to bring in Dr. Ziauddin on, and Dr. Bilal, if you can wait backstage, we'll get Dr. Ziauddin on. Dr. Ziauddin, who has been joined us from Blackpool Hospital, and basically Dr. साहब आपने गुफ्तगू सुनी, डॉक्टर सख्तवी की भी और डॉक्टर बिलाल ने भी गुजराती में बात की, इंग्लिश में भी. तो यही है कि ये वायरेंट के हिसाब से वैक्सीन का क्या इफेक्ट है, या दो वैक्सीन है, कौन सा बेहतर है. कई लोग ये समझ रहे हैं कि हम वाइजर लगाएंगे, वो नहीं लगाएंगे. ऐसे जो आपने बात सुनी है कि मौजूद में आप उर्दू में थोड़ा गुफ्तगू कर लें. जज़ाकुमुल्लाह खैर.
वैक्सीन जो है दोनों इफेक्टिव हैं. सिर्फ ये है कि जो फाइजर का वैक्सीन है, जैसे पहले एक्सप्लेन किया डॉक्टर बिलाल ने, कि उसको जो स्टोर करने के अंदर कुछ प्रॉब्लम्स हैं, और प्रॉब्लम से मतलब ये है कि उसको स्टोर करना जरा डिफिकल्ट होता है, लेकिन इफेक्टिवनेस दोनों की उसी तरह है. अभी किसी ने क्वेश्चन किया था कि कितने अरसे के अंदर ये इफेक्टिव हो जाती है. तो इट टेक्स फ्यू वीक्स बिफोर इट कैन बी इफेक्टिव, एंड वी नीड टू गेट द सेकेंड डोज विद इन 3 weeks to 3 months. एक तो ये था. दूसरा ये कि वैक्सीन जो है वो बॉडी के इम्यून सिस्टम को बूस्ट करती हैं. तो उसके लिए आपके, यानी एक नॉर्मल इंडिविजुअल के लिए वैक्सीन जो है ना वो क्वाइट इफेक्टिव है. एक दरमियान में क्वेश्चन किसी ने किया था या कमेंट आया था कि अगर ये जो वेरिएंट्स आ रहे हैं इसकी वजह से वैक्सीन इफेक्टिव है या नहीं है. तो उसकी वजह ये कि अगर वैक्सीन नहीं लें आप, तो फिर तो आपके पास कोई भी इम्यूनिटी नहीं है. आपको क्या पता कि किस वायरस से आपको इन्फेक्शन हो रही है, कौन सा वेरिएंट आपके बॉडी में जा रहा है. तो अगर आप वैक्सीन लेंगे तो एटलीस्ट आपकी प्रोटेक्शन उससे बेहतर होगी जो किसी भी आदमी को बगैर वैक्सीन के हो सकती है. मैं फ्लू का वैक्सीन पिछले मेरे ख्याल 20 साल से ले रहा हूँ, जब से मैं ट्रांसप्लांट में काम कर रहा था. और मुझे अंदाजा है कि मुझे वैक्सीन लेने का फायदा ये होता है कि जब भी फ्लू होता है किसी को फैमिली के अंदर, मुझे उसका इफेक्ट ना होने के बराबर होता है, और बहुत कम होता है. यही चीज जो है वो एक आम पब्लिक के लिए भी है कि अगर खुदा ना खास्ता किसी को बाद में कोविड-19 होता भी है, तो उसका इफेक्ट उतना ज्यादा नहीं होगा जितना इस वक्त हो सकता है, क्योंकि इस वक्त तो जानलेवा है वो. यानी इस वक्त अगर हो जाए किसी पर्सन को जो कि उसके लिए वनरेबल है, यानी डायबिटिक पेशेंट्स, ओबीस पेशेंट, चेस्ट इन्फेक्शन वाला पेशेंट, वो मरीज जिसको किसी तरह की पहले से प्रॉब्लम चल रही है, तो उसके लिए तो ये बहुत ही सीरियस कॉम्प्लिकेशन पैदा कर देगा। एक चीज यहाँ मैं बताता चला जाऊं कि कुछ लोगों का ख्याल ये होता है कि हम तो यंग हैं, हेल्दी हैं, हमें तो जरूरत नहीं है वैक्सीनेशन की। आपको बेशक इसकी जरूरत ना हो, लेकिन आप जिस फैमिली में रह रहे हैं वहां पे कोई वनरेबल आदमी मौजूद होगा, या आपके फैमिली में अपने कोई आपके पेरेंट्स जो हैं वो बूढ़े होंगे, आप उनको वो वायरस ट्रांसमिट कर सकते हैं बहुत इजीली। तो आप कोशिश ये करें कि आप ना सिर्फ अपने आप को प्रोटेक्ट करें, बल्कि उनके लिए भी सोचें कि आप उनके इन कांटेक्ट आते हैं, तो इसकी वजह से आप उस चीज को अवॉइड करें ताकि उनको ये बीमारी ना लग सके, बेशक वो आपके ऊपर असर ना कर रही हो। ये मैं मुख्तसरन बताना था।
जज़ाकल्लाह खैरन। पंजाबी में भी थोड़ी ट्रांसलेशन कर देते हैं कि देखो कि डॉक्टर साहब कह रहे हैं, डॉक्टर सख्तवी जो डायरेक्टर है मेडिकल वेल बीइंग लैंकाशायर काउंटी काउंसिल की तरफ हुई, तो दूसरा ये प्रोफेसर भी है ना, डॉक्टर भी है ना, फिर अपने हमारे डॉक्टर ज़ियाउद्दीन साहब हैं, डॉक्टर बिलाल ने यही मैसेज दिता है कि मेडिकली तौर पर ये बहुत ज़रूरी है तुसी वैक्सीन लो। वायरल जो डिफरेंट आ रहे हैं वो हर जरा बीमारी आती है, फ्लू की बीमारी है या जो कुछ भी बीमारी, ਉਹਦੇ ਨਾਲ ਮੁਖਤਸਰਨ थोड़ी चेंजिस होती है, जरा जर्म्स वगैरह इन्हों का जरा सिस्टम है वो थोड़ी चेंजिंग होती है। ये मतलब नहीं तुसी वैक्सीन ना लवो कि वजी वैक्सीन वायरस चेंज हो रहा वैक्सीन नहीं लेना। डॉक्टर ज़ियाउद्दीन ये कह रहे हैं कि देखो कि तुसी खुद समझो कि वजी तुसी वैक्सीन नहीं लेना फिर तो तुम्हारे को कोई प्रोटेक्शन नहीं है। तो इस वास्ते इस साडे फर्ज बनता है कि इस चीज़ असी अपनी नवी नस्ल में भी समझाइए, क्योंकि यो थोड़ी गुफ्तगू चल रही है कि भाई नवी नस्ल कह रही है कि ये इसका ज़रूरत नहीं है। तो आज देखो नवी नस्ल 25 साल का बच्चा यंग मैन passed away last week. Today we buried our beloved brother Hafiz Salim at the age of 50. So basically, you know, Allah give him all Jannah and give patience to the family, but people are dying from all age backgrounds, so we're very lucky. तो इस वजह तुसी देखो ਅਸੀਂ ਆਪਣੇ हाफिज साहब ਨੂੰ आज दफन किया है, कल 25 साल का बच्चा फौत हो गया है। तो इस वास्ते ये साडा बहुत इंपॉर्टेंट है कि ये ਜਿਹੜੇ सवाल है ना करो, अपनी शक शुबा दूर करो, मगर ज्यादा टाइम ਇਹਦੇ ਵਿੱਚ ना इन्वॉल्व करो। जो मेडिकल एक्सपर्ट शेख सलीम ने कहा है कि वे देखो मेडिकल एक्सपर्ट या उलिमा फरमा रहे हैं, ठीक है, कुरान भी फरमा रहे हैं कि जे तुहानू नहीं पता उन्हां को पता करो जिन्हां नू पता है। तो इन्हां नू पता है सानू दस रहे हैं, इहदे मुताबिक तुसी लब्बैक करो, बिस्मिल्लाह करके इन्हू अपनाओ। So now we're going to ask our local Imam Abdul Rasul Al-Bri Sahab. Dr. Ziaddin, he'll take your place in a minute and we'll bring you back in shortly. So Dr. Imam Abdul Rasul Al-Bri Sahab from Raza Mosque, Preston, Imam Khatib of Raza Masjid, Preston. Jazakallah khairan, Imam Sahab, for joining us. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Jazakallah khair, Brother Kamran. And all the brothers who participated in this beautiful event, and congratulations on organizing such an event to create awareness in your community. And I'm pleased, and I'd like to congratulate all of you and your team who have helped you in this beautiful event. First of all, Islam, as far as Islam concerned, Islam is very simple. As Allah says in the Quran, that deen, I have made this deen for you very simple and very straightforward. As it says in the Quran, وَمَا جَعَلَ عَلَيْكُمْ فِي الدِّينِ مِنْ حَرَجٍ. The deen is very simple for you to follow. There is no hardship in the deen. So there is nothing hard in the deen. So do not create. And then in another voice, Allah subhanahu wa ta'ala says, يُرِيدُ اللَّهُ بِكُمُ الْيُسْرَ وَلَا يُرِيدُ بِكُمُ الْعُسْرَ. That Allah subhanahu wa ta'ala want to make it easier for you rather than make it hard for you. He does not want the hardship for you. So now there are misconceptions in our community when it comes to the vaccine. And I've come across many stories on social media and on my WhatsApp groups, and people like to share without knowing and noticing that what they're actually sharing. They get something from someone, they forward it to another person without noticing, without judging what they're actually spreading. And when it comes to the deen obviously, first thing it says, when you have some kind of news, rather than spreading it to somebody else, verify it, dig into it, know, and go to the expert, like the brother Salim was saying before, but Dr. Bilal also mentioned some of the things, that without knowing something, you cannot just go and spread. You need to have the proper knowledge for it. And likewise, the brother said before earlier on that if you don't know, you go to the relevant person. So if you want to know anything about medical, go to the doctors. If you want to know something about science, go to the scientist. So those people who have the expertise in these matters, go to them. Same way in the Quran. If you want to learn Quran, you go to the imams and scholars and quras. And same way, if you want to go to colleges, universities, businesses, you go and study to the relevant people. Same thing when it comes to these kind of things. We should refer to these doctors who actually have been saying to us from day one that please, if you get the invitation, get the vaccination. Before, when we were going through the lockdown, and at that time the doctors were saying to us that please have the social distancing, make sure we wash our hand, make sure we do take all the precaution and measures and whatever the government says, that we should follow these steps to prevent. If I am not getting, that doesn't mean that I'm perfect, or I'm not going to pass it on to other people. Maybe I've already had it, but because my immune system is strong, I may not be able to see those effects, but I may be passing on to other people. So when it comes to these kind of things, one of the hadiths, I just remember that Prophet ﷺ said to one of the companion that if your camel becomes ill, you don't take that camel and to the other camels, where all the camels are. You take that one camel away from the rest of the camels, so you don't pass on to that disease to the rest of the camels. So it's very simple that if we want to implement onto our life, if we have the disease and that disease we know for sure this disease spreads very easily, we should keep ourselves away from one another, and we should isolate ourselves. Or same way, if we know somebody has it, we try to keep away from that person rather than just going into it. Then, very unfortunately, when it comes to our community, we actually don't want to hear stories. We just want to do things what we think is right. We don't know. We don't want to hear things from the government. We don't want to hear things from the doctors. We don't want to hear things from ulama. When it comes to telling something, we don't want to follow it. That is very unfortunate with our community. But alhamdulillah, now the brothers are trying their best to create awareness in the community, and some people are actually starting to understand and start to fall into that.
एक सवाल है, सॉरी डिस्टर्ब, अक्सर ये सवाल किया गया है, तो ये आप उर्दू में भी कर दें और इंग्लिश में भी, कि बेसिकली ये कह रहे हैं कि रमज़ान आ रहा है और रमज़ान में ये वैक्सीन लगाना कैसा है, और ये रमज़ान के बाद लगाना चाहिए या रोज़े की हालत में ये वैक्सीन लगा सकते हैं. So I'll just explain that question in English, that basically there's somebody asked a question that basically Ramadan is coming, so are we allowed to have this vaccine whilst we're fasting? And the other thing is, or should we propose it after Ramadan?
So there are two things, Brother Kamran, here. If someone is fasting and obviously I have no idea about the medicine, there's something doctors can tell. If the vaccine leaves effects on the stomach, and if it enters in the stomach, then obviously it is not permissible during the fast. And if it does not enter in the stomach, then yes, it's okay. Like some people take the vaccine even while they're fasting because of their illness or the disease they have, but that vaccine does not affect the stomach. So as long as the vaccine does not create any effect or does not go into the stomach, does not enter in the stomach, then it is permissible to use the vaccine.
इसमें तो नहीं है ना ये, क्योंकि ये तो स्किन के ऊपर लगता है ना,
ऊपर लगता है, लेकिन अगर इस असरात अंदर जाते हैं, जी, अगर इसके असरात अंदर जा रहे हैं पेट के अंदर, अगर तक इसके असरात नहीं जाते तो फिर कोई मसला नहीं, क्योंकि लाजमी नहीं, बाज होते इंजेक्शन जो जाके मैदे पे असर करते हैं. अगर खाने का जहाँ खाना जाता है वहां अगर ये नहीं जाते तो उस वक्त ये ठीक है, उस वक्त तक ठीक है. अगर ये जाते हैं, क्योंकि इसके बारे में मुझे इसलिए इल्म नहीं है,
बेहतर है आज में पूछ लेना चाहिए.
Dr. Bilal will be able to explain that in detail कि अगर ये असर करते हैं तो फिर नहीं है, और अगर नहीं करता फिर yes, we should go for it. हमें फिर ये जरूर लेनी चाहिए वैक्सीन. अब वैक्सीन की जो बात आती है, इस्लाम ने जो कोई भी बीमारी अल्लाह ताला इस दुनिया में भेजता है, उस पर फरमाया कि बीमारी उस वक्त तक नहीं आती जब तक कि उसका पहले हल या उसका क्योर ना आ जाए. अस्सलाम वालेकुम ब्रदर डॉक्टर बिलाल, मुझे बड़ी खुशी हुई आपसे देख के, तो अल्लाह आपको Yeah, in the beginning as well we spoke. तो ये बिल्कुल सिंपल सी बात है. हमें चाहिए कि जो है ना दीन को उतना समझे जितनी इसकी जरूरत है. अब एक आम आदमी है, उसको अपनी जिंदगी में जैसी जैसी चीजें चलती हैं उस हिसाब से दीन को समझ लेता है, लेकिन जब बात आती है हलाल और हराम की, तो उलमा और कुरान और मुफस्सिरीन और हदीस में अंबार लगा हुआ है, बहुत सी ऐसी चीजें हैं जिसमें साफ साफ कहा गया है कि कोई चीज उस वक्त तक हराम नहीं है जब तक वो कुरान ने हराम ना की हो या हुजूर पाक ने हराम ना की हो. There is nothing haram unless it has been mentioned in the Quran or in Hadith. So do not make things haram onto yourself unless it has been mentioned. तो हम अपने तरफ से कह दें, सोच ले जी किसी ने कह दिया कि फलानी चीज में तो हराम है, नहीं, उस वक्त तक चीज हराम नहीं होती जब तक उसमें कोई प्रूव ना हो कि हाँ ये हराम है. अब जब हमारे डॉक्टर्स हैं, हमारे मेडिकल स्टाफ है और जो कंपनी जिसने वैक्सीन बनाई है, अब वो ये बात कह रहे हैं कि इसमें कोई ऐसी चीज है ही नहीं हराम. एक तो इसमें दो सूरत हाल है, एक तो किसी चीज का मौजूद होना और एक है नहीं होना, और एक है मौजूदगी हो या ना हो इसका इल्म ही नहीं है हमें. If we do not know whether they have it carries something haram or not, it's still permissible to use it because you don't know. And if you don't know, and Sharia allows you to use it. अगर किसी चीज का इल्म नहीं है कि इसमें है या नहीं, तो फिर भी तुम यूज कर सकते हो. और एक चीज है इस एक में है ही नहीं. If there are people who are verifying there is nothing haram in the vaccination or in the injection or whatever that medicine is, it does not carry any haram thing that then we should go for it without even questioning. फिर ये हमारी जिम्मेदारी बनती है कि हम इसको लाजमी लें. Now comes to the last point, which is if it carries something, कोई हराम चीज है जिसको ले वैक्सीन में है, but it is not in its original shape. For example, a donkey dies in the somewhere. Let's say a donkey dies in a salty cave, and then the salt dissolves the donkey and turns it into a salt. Now, donkey itself is haram, but now because it's been dissolved in a salt, we don't know. We cannot differentiate. It looks the same salt. So then, in that case, the salt is usable and it is halal. Okay. Same way, the soil that we bury in, people do things on it. The animals poo on it, and there's a water. All kinds of things go in the soil. But the soil is park. That's why we do tayammum with it to do salah. We use it to do istinja with it. But eating the soil, it is haram. But other than that, soil is park. So these are the cases in Islam that we need to understand very carefully. That if there's something which is haram, but it is being used to cure something to save humanity, that is more important than worrying about. And then obviously in that context, using something which is haram, if there is no alternative, if there is nothing else, but you have to use that to save your life, then yes, it is permissible to use it. Same way, if a woman cannot show the private part to a male or to a non-mahram, yes? But when it comes to the operation, and there is no female doctor, a male doctor is allowed to do the operation. And same way, woman will not get the sin and the doctor will not get the sin because there is no other option. But now here, we're talking about this saving life. And obviously, when you talk about the vaccine, it is to save humanity, to save people's life. This is what we're trying to do. And there are people who are spending millions and billions of dollars and pounds to make that vaccine, and someone comes out and say, "Oh no, I don't want to take that. It's for this purpose, for that purpose." No, that's you showing that how much knowledge you already have about Islam. Islam is very clear. So, brother and sister, we should stick to basic things. And Islam बड़ा बिल्कुल साफ है. इसमें कोई वो दूसरी बात नहीं है. सादा सी बात है. अगर किसी बात का पता हो कि इसमें बुरी गलत चीज है, लेकिन वो भी उस वक्त भी इजाजत है उसकी, अगर जान बचाने की बात आ रही है, और यहाँ जान बचाने की तो बात की जा रही है. वरना वैक्सीन और है कि अब डॉक्टर हैं हमारे माशाल्लाह, डॉक्टर बिलाल है और पूरी दुनिया मुसलमान डॉक्टर हैं जो ये बात कह रहे हैं कि भाई इसमें कुछ नहीं है. और शरई हुक्म ये आता है कि अगर कोई भी मुसलमान एक इस बात की गवाही दे दे तो दूसरे मुसलमान पे लाजिम है कि उस बात को माने कि हाँ ये मुसलमान सच कह रहा है. तो ये तो एक मुसलमान का दूसरे मुसलमान के लिए ट्रस्ट भी होना चाहिए. और अगर हमारे डॉक्टर्स कह रहे हैं कि इसमें कुछ नहीं है, तो फिर हमें इसमें झिझकना नहीं चाहिए. तो हमें ये वैक्सीन जरूर लगवानी चाहिए.
जज़ाकल्लाह खैरन हज़रत, मुख्तसर टाइम में आपने माशाल्लाह बहुत खूबसूरत पैगाम दिया. तो जज़ाकल्लाह खैरन हज़रत, आप एक मिनट स्टेज के पीछे रहे. वो शोएब भाई, if you take Imam Sahab back to the stage and bring Frank, our county councillor, because there's a question. Just before we go to Frank, hiya Frank, you okay?
Yeah, good evening everybody. I'm very well, thank you. Very well. Can you hear me okay?
Thank you for taking your time out and joining us. I know you've been with us from the starting of the program and supporting us all the time, like you always have been. Thank you very much. But before I come to you, Frank, I just want to ask a question to Dr. Bilal, which was related to the question, Dr. Bilal, you know, the question was that in Islam, obviously Ramadan is coming. So in Ramadan, the question is that are we allowed to take the vaccine? Will it break our fast, or shall we wait after Ramadan if the date comes in Ramadan? I mean, the Imam Sahib has explained the ruling that basically if it goes to your stomach content, your stomach, then that way basically it will break your fast. Other than that, if it's on your skin, stays with above your skin, then basically it won't. So, but he said, ask yourself that is that the case? Will it affect the fasting in that sense?
No. So this won't invalidate the fast.
So
the injection goes into the muscle, into the skin, and scholars have given a ruling on this as well, that taking the vaccine during Ramadan will not invalidate the fast.
You can just say the same thing in Gujarati, and then I'll just quickly translate it in Urdu and we'll move on to Frank.
Ramzan ni andar roza rakhelo hoy to tame vaccine leso te inti tamaro roza nahi tuti jai mane e ulama lokawi joine na fatwa dilo che keunke je injection je che hat ni andar jait e pet ni andar ini asal nahi.
जज़ाकल्लाह। डॉक्टर साहब ने ये क्लियर कर दिया है, क्योंकि हमारे इमाम साहब ने कहा था कि देखो अगर ये पेट के अंदर जाता है तो रोज़ा टूट जाएगा, अगर मांस के ऊपर रहेगा तो नहीं टूटेगा। तो इसमें सिंपली डॉक्टर बिलाल साहब ने क्लियर कर दिया है कि ये रोज़ा नहीं टूटेगा, क्योंकि ये मांस के स्किन के ऊपर लगता है, मांस के साथ इसके साथ ताल्लुकात हैं, इसका स्टमक मैटर के साथ कुछ भी नहीं है। तो गुजारिश है, पंजाबी विच भी तुहानू ये समझा रहे हैं कि डॉक्टर साहब ने भी क्लियर कर दिता, इमाम साहब ने भी, कि वही रोज़ा इस हालत में नहीं टूटदा। जे तुहाडी डेट आंदी है रोज़े रमज़ान विच तुसी लै लो, ते मुख्तसरन जेह्ड़े साइड इफेक्ट ने सर दुख वगैरह वो तो होना ही है। ते रोज़ा तो एक अल्लाह दी तरफों एक नेमत है, तो इंशाअल्लाह उहदे जरिए अल्लाह तुहानू शिफा भी देदा इंशाअल्लाह, आमीन। Frank, just, I know you had your vaccine and I wanted you to explain to the people that did you have any side effects, and then I've got a couple of questions relating to with Dr. Sakhtawi from the county council. Obviously he gave us his time, he had to leave, but yes, this question is the council has received millions from central government. Why don't we have mental health service, especially for Asian community that understands our culture? This is to do with mental health as well, and I think it's trying to say about the sport, you know, to make sure that this is basically not the case. That there is the money there and it's being spent on that. So I think there won't be a clarification that mental health funding, which has been given from the government to the council, is that being spent on the minority communities, and also how is it helping the vaccine program? Vaccine program.
Good. Okay. Good evening, Cameron and distinguished guest. Yes, what you said is quite right. The money has been given to council up and down the land, and the money has been allocated. Obviously, during the course of the pandemic, the mental health issue has increased tremendously, and of course, people they're struggling. They find themselves in a situation whereby nobody would actually even dream prior to last year, when the pandemic started, and it's been very, very hard on the people. They feel lonely, people they feel stress, and all sorts of things happening. But yes, the money has been allocated and is being rolled out. Seen a similar basis like the vaccine, no question about that. If I can say about my experience, it's only over 2 weeks or so ago when I received the vaccine. I did not hesitate to go to the clinic, and I never felt anything about it at all. I would like to encourage everybody, in our community in particular, to having made the offer, for goodness sake, take it and go. Also, sadly, so Dr. Safti is gone, but what I would have asked him, if it was possible, is to ask him, you know what's happening up and down the country, whereby doctors, they're going out on site to the most vulnerable people, or people maybe they might be a little bit edgy in getting the vaccine. We should have some people going around, like they do elsewhere in the country, and encourage the people that they be skeptical to get the vaccine done. So
sorry, Frank, just sorry to interrupt, but on that note, obviously the county councillor. So would you take that forward and try to get that, arranged?
I will send an email to Dr. Safti. Yes, I'll do that and ask him whether or not the program, because we know we got a case or one more case in here of the Asia, the African virus is coming to Preston. We know that, and therefore we need to protect the population at large. So I will ask the question whether or not there's any facility which is being given elsewhere for people to go out and encourage people to get the vaccine. But please, I'm begging everybody in our community, and I'm talking about the ethnic community, because, as you say, there's been a lot of speculation about this, a lot of people making innuendos when not there. Please do go and get the vaccine, and because that's the only, if you want to leave, that's the only way you can do it. I'm honest with you, I'm looking forward maybe to April when the next vaccination is coming, and I will go there again, God willing.
Right. Thank
you very much, Cameron.
Thanks a lot. See if you can just translate that part, the Islamic part, because it was what the previous scholar had just elaborated. So we leave that one out, and just we get Frank's about his experience and his advice.
Cameron l-a întrebat pe domnul Dr. Frank cum au fost, dacă au fost alocați banii care au primit Consiliul, și a spus, bineînțeles, banii au fost alocați în această perioadă pandemică pentru că oamenii sunt singuri, oamenii sunt stresați, sunt într-o stare nu prea bună acum și bineînțeles că trebuie să fie ajutați. Eu, de exemplu, când am auzit de vaccin, m-am dus și m-am vaccinat. Eu, Frank. Nici nu m-am gândit, nu am avut nici măcar un gând să nu mă duc sau să mă duc sau oare ce o să se întâmple, ce nu o să se întâmple. Am avut posibilitatea asta, m-am dus, mi-am făcut vaccinul, pentru că, bineînțeles, noi suntem expuși, pacienții pe care avem, oamenii pe care îi întâlnim zi de zi. Și chiar vă rog, și sfatul meu este, domnul Frank spune, sfatul meu este, dacă aveți posibilitatea și puteți, vă rog să vă duceți să vă faceți vaccinul.
Thank you very much. Can we have Councillor Zafar now? She has been with us from the starting of the program, and she has been waiting patiently at the backstage. She has always supported us. So, Shoaib, if you can put Dr. Saab on the stage and backstage, and bring Councillor Zafar on, please. I mean, overall, the message, Frank, we're grateful that you've given your time out.
Not a problem.
Before Councillor Zafar comes on, Councillor Zafar has been working to get some COVID marshals. They are being seen basically in in the town centers and places like that. But basically, Councillor Zafar, she's here, Councillor Zafar. If we put that question to Councillor Zafar due to shortage of time as well, and I'm really sorry, Councillor Zafar. Thank you very much for all your support. I'm sure it's been a great program. You've been taking part in the backstage, and we're very grateful for all the advice you and Frank has been giving us as the community. And you're a councillor from the Deepdale ward. I was just talking about the COVID marshals, which you have been trying to get for the local community as well. And just before that, obviously, the message on the vaccine, how our community needs to take an active step. And also, I think there's some misconceptions as well that majority people don't want it. I think minority who don't have the, I think it has not been communicated to them. What do you think about better in communication and how we can roll this out?
Thank you, Brother Cameron, for inviting me to this talk. It's been really interesting to listen to all the medics and their perspective on the vaccine, and hearing the doctors and trying to encourage communities, especially from the BME community, to take the vaccine. But I think your first question on the marshals is something that we're working with, and we're trying our best to get them there into the community so people can, adhere to the criteria, wearing the masks and following the 2 meter distance, and keeping safe and washing hands. So we're working on that one. I think secondly, I think a BME community that, it's about, yes, there are misconceptions out there, but it's about bringing those misconceptions and having that talk and having that education process, isn't it? And it's about working with established organisations, that we as the 4 councillors for the Deepdale ward in particular, working with the GPs and working with the communities, yourself, Preston Muslim Forum, Preston North End, and getting that message out there to say how important it is to engage and understand. And, there's lots of issues within BME communities, deprived wards, the unemployment, the poor health, and the benefit culture. So it's all about those things. And if you've already got poor health and you're not understanding something as important as having a vaccine, this is something new. How do we go out there and educate people in all different languages, bilingual, to say that how important the vaccine is? So I think that's a conversation to be had. And we are, as councillors, promoting that through other organisations. Preston City Council, has put a lot of funding in organisations to be able to spread that message, along with Lancashire County Council and the Public Health Director, Dr. Sekhthi. So myself and the councillors are out there promoting that message with the help and support of key organisations in the community.
So, I mean, overall, like Frank was talking about, like, maybe Dr. Sekhthi or the county councillor or the county
Preston City Council.
Yeah,
if
Preston
it comes to
City
that.
Council, if they can go out to the local mosques or temples and, whatever they feel, that how they can get this message out. I mean, our respected scholars earlier elaborated that, the majority of the people are with this. It's only a minority who might be a bit confused or misunderstand. And some of it is like the question here, what about this is going to the elders, right? And some of them, just getting text messages and they can't read text messages. So, or how are they getting that message to them, the GPs, the access to the GPs?
And absolutely, and those are things that we have talked about a number of times. That text messages to the elder, it's got to have a better communication system, and that has got to be worked within a multi-agency, the Lancashire County Council, Preston City Council, the GPs, the community organisations, and how can we act as ambassadors in that community to get that key message to people who really need it? And I think we are doing that. And as I've just said, that the City Council, along with Lancashire County Council, have put a lot of money into communities to be able to, employ key organisations like, Preston Muslim Forum, Gawattdale Education Centre, Preston North End, to get key messages to yourselves in the community to say how important it is for you to understand what vaccine's all about and what COVID-19 is all about. I mean, and there's more work to be done as well,
Yeah, that's what I'm going to ask. I mean, I know this is the first vaccine. I mean, the work more is needed to be done. Obviously, the second dose, and some people have still not received that. Obviously, it's a big rollout. We're lucky to have, as our scholars and other speakers, medical doctors have elaborated. But in terms of, as the community, getting that information from the doctors, from the local surgeries, from the local counsellors, and like Frank was suggesting, maybe, going to the local mosques on a Friday, getting the announcements made, things like that. Maybe that might work. So, I mean, what is the council doing in that sense? or yourselves? How are you feeling what they're doing?
At the present moment, the council has just rolled out, Preston City Council has just rolled out quite a lot of money to different organisations to be able to work within the BME community across Preston to get that key message out. Now, I think one of the things that we can do is that let all the communities know which organisations have got that funding to be able to work in that community, as well as along with the 4 councillors in Deepdale, and that goes across Preston.
I mean, yeah, I mean, that's great stuff. I know we've been promoting that previously as well. But also, do you feel, Councillor, that, you know, there's a question which I asked earlier to Dr. Sakhtri as well, and I think if it's been asked again, that they feel that the image of the, you know, minority communities, you know, especially the BAME communities, have been tarnished by this thing that, you know, they're reluctant to get vaccines, and that is not the case. I've spoken to many scholars, and earlier the scholars elaborated the same thing, and I myself had an injection because I've got you know, some illnesses, and basically others have been doing. I've not had anyone saying I've had a call and I'm not having the vaccine. So why is it that we've been pushed like this or brushed like this as a stereotype? Do you feel that it is?
It's going back to that media, isn't it? It's that story that goes out there, and it's about us. But I think the positive note to that is that, you know, we could spin to show, you know, statistics, data, how many people in the BME community are actually having this vaccine.
Exactly.
And the more people that having it, and that will show for himself. It will show for itself that the other side of it, the negative side of the BME community not engaging, will go away. As soon as the more BME communities are having the vaccine and participating and advocates themselves for it, is sending a clear message out.
I mean, there's another question with this, and I mean, really, I don't know if you can answer this, because it's a Martin. Martin asked 2 questions that you know, to get through our GPs, the receptionists, and the way they have been treating people. He's 60 plus. He's not received any information about the vaccine. He's got some illnesses as well. And Martin feels that, you know, just to inquire, you know, you get like talked down to from the doctor surgeries. I'm sure it's not the case everywhere, but if that is happening to somebody, how can they resolve that? Who can they go to?
Well, if we're talking about our Deepdale ward, then they can ring one of the councillors up, and we can support that.
Okay.
We can, you know, support that. We can speak to the GP on their behalf, and it's something that we're already doing, is trying to get GPs on board. I mean, from what I understand, and I don't know what Frank's view this is, the GPs have been non-stop ringing and their patients to try and get them to come and have the vaccine. I've had nothing but positive. Frank?
Yeah, I think overall I got that because I got a call, so I'm going to vouch for that. And many people, my parents have had that call. But obviously, there is some people who are feeling like this. And if they are feeling like this, Martin, then I think Councillor Zafar will pass your number.
Yeah, more than happy to support and help. Yeah.
Yeah. Thank you for that. In Deepdale, you know, there's funding for COVID in the Deepdale ward. The fundings which have been given to all wards. How is that being used? And this is a question: how is that being used by the councillors or whoever has access to them? So it's a very wide open question, like, you know, in terms of youth, in terms of COVID, wherever there's a need, food parcels, whatever the funding has been given, has it been used to promote the COVID and the vaccine program?
Right. From Preston City Council, the funding's only just been approved last week, and to the organisations. So how that is going to be rolled out is, I don't know yet how the organisations are going to be rolling that out. But what we can do is, as soon as we know as councillors, we can feed it back into the community and say that these are key organisations. We can tell you who the key organisations are, and we can then inform key organisations to say, you know, this is how they're going to be working with the BME community across the wards, and this is how the money is going to be used. So you're engaged in that programme.
Okay, thank you very much for that, Councillor. Councillor Frank. And I know you're coming to the end of the programme, but before that, we're going to bring the doctors back on and give their message. So final messages, Councillor Zafar, in terms of encouraging people to go out and get the vaccine, and we get a few words from Frank, and then we get Asi to translate for us.
I think it's like what everybody else has been saying. It's about that engagement, isn't it? How can we go out and talk to people, do and open that education process to see how important it is for your health and well-being, and how we can do that on grassroots level as councillors and promote that with other key organisations in our ward.
Thank you. Councillor, as you're with us, I've just received another question here. Some people are feeling that doctors are picking and choosing patients. The first we've heard that it's going to be over the 70s, and now we hear that some 30 and 40 years old are receiving, like I've received my jab. I think you just explain that. Why is that case?
Well,
do you think? I don't think it's picking and choosing. I think the person.
I'm honest with you. I cannot see that.
Yeah, it's vulnerable. Is that right, Councillor Zafar? It's the 70 plus and then the vulnerable, is it?
I think, if I'm really honest, Cameron, that's a question that should be asked by the doctors that are taking part today, because I don't know how the criteria is working other than what I read in the media myself.
Yeah, so we'll bring the doctors back on. Thank you very much, Councillor Zafar, for joining us and staying with us throughout the program. Thank you very much for your support, and thank you very much.
Before I go, can I just say, condolences to everybody that's passed away in Preston and in Deepdale Ward. Thank you.
Right, thank you very much, Councillor. Dr. Bilal, if you could just speak about that, why is that case? And we got Dr. Saab as well. But before that, can we bring Wasi in? Wasi, I know you're coming to the end of the program, and if you could just briefly give that last message from Councillor Zafar, and then you can take leave. I know you have to leave at 7, so we've got 1 minute, so you can translate. And then thank you very much for all your support, and your company has been doing amazing work translating in Romania and other languages, Eastern European languages, and surely we will use it in the future as well.
You're very welcome. You're very welcome, Kamal. Thank you. Mesajul pe care doamna de la Consiliu a spus, dacă aveți posibilitatea, bine, mergeți, vă vaccinați. Noi, între comunități, încercăm să ajutăm, să trimitem mesaje. Doctorii fac același lucru, trimit mesaje la pacienți ca să îi cheme la vaccinare și să facă acest pas. Bineînțeles, la sfârșit a spus, dăm condoleanțe pentru toți cei care au trecut la Domnul și și-au pierdut viețile în această perioadă pandemică, atât în Preston cât și în alte zone de Lancashire sau alte zone peste tot de altfel în lume. Vă mulțumim, la revedere, o seară bună.
Okay. Thank you very much, Wasi. And thanks.
You're very welcome, Kamal. Have a good evening, everybody.
You too. I'll see you soon. Thank you. Mashallah, Dr. Saab, I know we're going a little bit over because I want you to help stay with us. We're going to make dua for all the people who have lost their lives and those people who are ill as well. Just that question, somebody said that basically some doctors are picking and choosing patients, and they just it was meant to be the 70 plus, but then we're hearing that 30-year-olds and 40-year-olds from different surgeries are getting their vaccine. So what's going on?
So I can speak from what went on in the hospital perspective. The Pfizer vaccine, which was the first vaccine that came out, so it's stored at minus 70 degrees. So when it's defrosted, you have to use it in a certain number of days. And what was happening in the hospital setting was they were giving it to patients over the age of 80. But if there were any vaccines that were going to be thrown away, then rather than throw away a very valuable vaccine, if people turned up after 5 o'clock that weren't over the 80 category, then rather than throw them away, they would use them. And I can only presume that a similar thing has happened in the community. So when sometimes you might have booked in 100 vaccinations, if some people didn't turn up, rather than throw it away, give it to whoever was there. But so it's not just based on age, though. It's important. So the criteria are, one is based on age, and then you can have, you can be high risk with other conditions that you've got as well. So that also might explain, like somebody in the 40s with multiple health problems, for example, may be invited to come for the vaccine, who is, for 60 years old.
Yeah. So really, डॉक्टर साहब आप भी मुख्तसरन थोड़ा उर्दू में कह दें कि ये पिकिंग चूजिंग नहीं हो रही, क्योंकि 70s तो वो है, मगर वनरबल के लिए भी है। तो आप इस पर मौजू पर थोड़ी गुफ्तगू कर दें।
बिल्कुल मुनासिब है, क्योंकि वनरेबिलिटी एक बहुत इंपॉर्टेंट फैक्टर है, क्योंकि उसकी वजह से जरूरी नहीं है कि जो है वो 70 से ज्यादा हो तो उसको वैक्सीन दी जाए। हो सकता है कोई पेशेंट जो है जिसको इम्यूनो कम्प्रोमाइज्ड है और वो उसकी उम्र जो है वो 35 ईयर्स ही है, और तो उसको वैक्सीनेशन का उतना ही राइट है जो किसी एल्डरली पॉपुलेशन को हासिल है। तो एक तो ये वजह हो सकती है, तो ये चीज इम्पोर्टेंट। दूसरा, जैसा डॉक्टर बिलाल ने कहा कि कभी कभी वैक्सीनेशन जब उसको निकाल लेते हैं तो दोबारा उसको रखना मुमकिन नहीं होता, तो उस वक्त जो भी अवेलेबल होता है, यानी उस वक्त वो अवेलेबल हो सकता है, उसको वो कॉल करके वैक्सीनेशन लगाने की कोशिश करते हैं ताकि वो ज़ाया ना हो। तो ये एक इम्पॉर्टेंट चीज़ है। और मैं मुख्तसरन आखिर में जो चीज़ कहूँगा कि इसको हमें एक इबादत की तरह लेना चाहिए, क्योंकि अगर हम इसको लगाएंगे तो हम ना सिर्फ अपनी जान बचाएंगे बल्कि दूसरों के लिए हम अपने यूजफुल हो सकते हैं, क्योंकि दूसरों के लिए भी फायदेमंद हो सकते हैं। क्योंकि इसमें इंटेंशन हमारी यही हो कि हमारा मकसद इसके अलावा कुछ ना हो, कि हम इसके लिए दूसरों की जान की हिफाजत करने के लिए हम इसको लगवा रहे हैं या इसको लगाना चाहते हैं। अभी कोई क्वेश्चन आया था कि वैक्सीनेशन से एलर्जी वगैरह की बात है, तो वैक्सीनेशन से एलर्जी, अगर आप नॉन एलर्जिक हैं किसी पर्टिकुलर इंग्रेडिएंट से, तो फिर आपको नहीं लगानी चाहिए। लेकिन पेनिसिलिन से इसका कोई लिंक नहीं है आपस में। वो आपसे क्वेश्चन पूछते हैं पहले से, अगर आपको लगता है कि आप किसी चीज से एलर्जिक थे पहले किसी वैक्सीन लगाने से, आप उनको बता दें, वरना इसका कोई आपस में लिंक नहीं है। वो क्वेश्चन का जवाब है जो दरमियान में पूछा गया।
हाँ, तो ये इसी क्वेश्चन के साथ एक दूसरा क्वेश्चन है डॉक्टर साहब के, आर्थराइटिस और ये जो बीमारियां हैं, दर्द वाली बीमारियां, तो इनमें भी लगाना चाहिए या नहीं लगाना चाहिए?
इसमें सब में लग सकती है, कोई इसमें कॉन्ट्राइंडिकेशन एज सच नहीं है कि आपको नहीं लगनी चाहिए, अनलेस कि अगर आप बहुत ही स्पेसिफिकली कोई चीज पूछना चाहते हैं तो अपने जीपी से, आप क्योंकि आपकी जीपी के पास आपकी फुल हिस्ट्री होती है, वो आपको गाइड कर सकते हैं फर्दर। लेकिन जनरली स्पीकिंग किसी भी चीज को वैक्सीनेशन की वजह से डिले नहीं करना चाहिए। कुछ स्पेसिफिक कंडीशन है, लेकिन मैं उसकी डिटेल में नहीं आना चाहता। सिंपली ये कि वैक्सीनेशन हर एक को लगाई जा सकती है।
अच्छा अच्छा, तो डॉक्टर साहब थोड़ा टाइम आगे चल पड़े हैं, मगर ये एक क्वेश्चन है कि ये कह रही है बहन, एक सिस्टर है कि उन्होंने वालिद साहब जो 70 के करीब हैं और वालदा भी 70 के करीब है, मगर उनको हार्ट के मसला है कि वालिद साहब को लग गया है, और जब उन्होंने वालदा के लिए कोशिश की है, फ़ोन किया है, तो वो कह रहे हैं कि आप अभी NHS को फ़ोन करें। तो NHS को करना चाहिए, डॉक्टर अपना जो जीपी है उसको करना चाहिए इसका इंतजाम?
जीपी को करना चाहिए, क्योंकि जीपी इस मामले में कस्टोडियन ऑफ अवर हेल्थ है, उसको कांटेक्ट करें। क्योंकि अगर एक को लग चुका है और दूसरे को अगर इन्फेक्शन हो जाती है किसी वजह से, तो वो इतना एडवाइजेबल नहीं होगा। तो बेहतर है कि जीपी से बात करके वो उसको भी लगाएं जो कि जिनको नहीं लगा इसको। बिल्कुल।
Jazakallah khairan. Same thing, Dr. Sab, with this question about arthritis and penicillin, and should we have, if we have arthritis or heart issues? Dr. Sab's elaborated in Urdu that it's for all, and regardless of vulnerable, obviously vulnerable and the elders come first. And what do you say with that one about just in English and Gujarati? So then after that we'll make dua.
Yes, so if you've got arthritis or heart conditions, this is not a contraindication, or it's not it's still very advisable to have the vaccine with these conditions. In fact, if you've got a heart condition, you're at greater risk anyway. So you should go ahead and have the vaccine.
If you can finish in Gujarati, and then we'll go through.
सवाल है उसके क्लिनिक है कि हार्ट में बीमारी હોય કે આર્થરાઇટિસ હોય તો વેક્સિન લેવાનું કે નહીં લેવાનું, જવાબ એ છે કે હાર્ટની કે બીમારી હોય मतलब કે તમારી રિસ્ક વધારે હોય કોવિડ ઇન્ફેક્શન થઈ જાય, એટલે તો વધારે જરૂર છે કે તમને વેક્સિનેશન લેવાનું અને આર્થરાઇટિસ હોય તો કઈ પ્રોબ્લેમ નથી વેક્સિન લેવાનું અને એવા કઈ કન્ડિશન્સ હોય તમારી પાસે એનો મતલબ એવો નહીં કે તમારાથી વેક્સિન ન લેવાય
यही है कि अभी के गुजारिश कर रहे हैं डॉक्टर साहब उर्दू विच भी गुजराती विच भी ਤੁਹਾਨੂੰ कह रहे हैं कि देखो कि भाई ਤੁਹਾਨੂੰ पेंसिलिन लवा रहे हो या ਤੁਹਾਨੂੰ आर्थराइटिस है या कुछ और कोई मसाइल ने कोई बीमारी है इसका मतलब नहीं है कि ਤੁਸੀਂ ना लवाओ हाँ अगर ਤੁਹਾਨੂੰ वैक्सीन दी इंग्रेडिएंट्स ਦਾ ਕੋਈ साइड इफेक्ट्स और एलर्जी तो फिर ਤੁਸੀਂ ਜਿਹੜੇ ਉਹਨਾਂ ਬਈ ਉਹ ਤੁਸੀਂ ਜਿਹੜਾ ਵਾ ਆਪਣੇ जीपी ਨਾਲ ਮਸ਼ਵਰਾ ਕਰੋ ਆਪਣੇ ਸਪੈਸ਼ਲਿਸਟ ਨਾਲ ਮਸ਼ਵਰਾ ਕਰੋ ਦੂਸਰੀ ਗੱਲ ਹੈ ਕਿ ਜੇ ਡਾਕਟਰ ਕਹਿ ਰਿਹਾ ਤੁਸੀਂ NHS ਨੂੰ ਜਾ ਕੇ ਫੋਨ ਕਰੋ ਇਹ ਡਾਕਟਰ ਜ਼ਿਆਉਦੀਨ ਸਾਹਿਬ ਨੇ ਇਹ ਗੁਜ਼ਾਰਿਸ਼ ਕੀਤੀ ਹੈ ਕਿ ਡਾਕਟਰ GP ਤੁਹਾਡਾ ਕਸਟੋਡੀਅਨ ਹੈ ਤੁਹਾਡਾ ਲੁੱਕ ਆਫਟਰ ਵਾਲਾ GP ਹੈ ਮੇਨ ਪਰਸਨ ਸੋ ਉੱਥੇ ਤੁਸੀਂ ਕੰਟੈਕਟ ਕਰੋ ਕਿ ਵਾਲਦ ਸਾਹਿਬ ਨੂੰ ਲੱਗ ਚੁੱਕਿਆ ਹੈ ਤਾਂ ਵਾਲਦਾ ਨੂੰ ਨਹੀਂ ਲੱਗਿਆ ਉਹਨਾਂ ਦਾ ਹਾਰਟ ਦਾ ਮਸਲਾ ਹੈ ਡਾਕਟਰ ਸਾਹਿਬ ਨੇ ਮਿਸਾਲ ਦਿੱਤੀ ਹੈ ਇੱਕ ਬੰਦੇ ਨੂੰ ਲੱਗ ਗਿਆ ਦੂਸਰੇ ਉਸੇ ਘਰ ਵਿੱਚ ਬਿਮਾਰ ਹੈ ਤਾਂ ਉਹਨੂੰ ਨਹੀਂ ਲੱਗਾ ਤਾਂ ਉਹ ਬਿਮਾਰ ਹੋ ਜਾਏ ਫਿਰ ਤਾਂ ਇਸ ਵਾਸਤੇ ਤੁਸੀਂ ਆਪਣੇ ਡਾਕਟਰ ਨੂੰ ਚੇਸਅਪ ਕਰੋ NHS ਕੋਲ ਤੁਹਾਨੂੰ ਨਹੀਂ ਜ਼ਰੂਰੀ ਜਾਣੇ ਤਾਂ ਤੁਹਾਡੇ GP ਦਾ ਇਹ ਫਰਜ਼ ਬਣਦਾ ਹੈ ਤਾਂ ਨਹੀਂ ਤਾਂ ਤੁਸੀਂ ਜੇਕਰ ਡਾਕਟਰ ਕਾਉਂਸਲ ਜ਼ਫਰ ਨੇ ਦੱਸਿਆ ਸਾਨੂੰ ਕਿ ਦੇਖੋ ਕਿ ਅਗਰ ਤੁਹਾਨੂੰ ਕੋਈ ਮਸਲਾ ਐਸਾ ਤੁਹਾਡੇ ਰਿਸੈਪਸ਼ਨਿਸਟ ਦਾ ਮਸਲਾ ਹੈ ਜਾਂ ਡਾਕਟਰ GP ਨਾਲ ਤੁਸੀਂ ਨਹੀਂ ਮਿਲ ਸਕਦੇ ਤਾਂ ਫਿਰ ਤੁਸੀਂ ਆਪਣੇ ਜਿਹੜੇ ਕਾਉਂਸਲਰ ਨੇ ਉਹਦੇ ਨਜ਼ਰੀਏ ਡੀਪਜਲ ਵਾਰਡ ਹੋਵੇ ਚੇਰੀ ਵਾਰਡ ਦਾ ਉਹਦੇ ਨਾਲ ਤੁਸੀਂ ਜ਼ਰੀਏ ਤੁਸੀਂ ਕੰਟੈਕਟ ਕਰੋ ਤਾਂ ਇਨਸ਼ਾਅੱਲਾ Jazakallah khairan to all our guests. Jazakallah khairan, Dr. Saab and Dr. Zia Khan Saab, Dr. Bilal, Councillor Zafar, Councillor Frank. We got apologies from Mend. She did join us, but some of the questions which we're going to put to her about stereotyping and stuff like that was answered by the doctors as well and by the scholars. So, Sister Amira, thank you for joining us. But unfortunately, this time she had the commitments elsewhere. So, apologies from the MEND team. But me, myself, and Brother Irfan and Dr. Jawardin is with the Preston MEND team as well. So, all that message was from the MEND platform as well, Deep Dot Community Association, PNE, and also from Meem Madaat Welfare and MSKA official. We make dua. A lot of people passed away in all over the world, and especially in the UK, 100,000 recently. Today, my neighbor 2 doors away, close friend, Hafiz Salim, a master, a teacher to many of the Quran, a imam to many, and also a very, very good friend, a blessed father, leaving behind 3 loved young boys, and also other people have died. An 18-year-old young man lost his life, not due to COVID, due to accident. And we pray for his family and for him. And all those people on St. Paul's Road, from one of our Munshi family, a respected Munshi family, elder person has passed away just recently. All these deaths around Deepdale, it's just been one after another. And Dr. Saab, you know, with yourselves, you've seen it firsthand. You've seen colleagues who have passed away, or you've heard of colleagues who have passed away at the front line, helping to save lives. And so today we end our program by reciting Al-Fatiha and Surah Ikhlas, and we make dua to Allah, God Almighty, that He elevates them to the highest Jannah and grants patience and sabr to their families and to their loved ones, and all those people who were serving the community and have lost their lives as heroes. They are our heroes, and we treat them like martyrs. And may Allah elevate them to the highest Jannah. Al-Fatiha. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen ar-Rahman ar-Rahim. Maliki yawm al-Din. Iyaka na'budu wa iyaka nasta'in. Ihdina as-sirata al-mustaqim. Sirata alladhina an'amta alayhim ghayril maghdubi alayhim wa la-d-dallin. الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يولد ولم يكن له كفوا أحد بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد والصلاة والسلام على سيدنا المرسلين. Ya Allah, Ya Rahman, Ya Allah, you are our Lord, you're the most merciful, the most kind. Ya Allah, Ya Rahman, we recited the Holy Quran. Ya Allah, Ya Rahman, accept any divine quote. Ya Allah, through the blessing of your beloved messenger, who you sent us, a mercy to mankind, mercy to all. And you, Ya Allah, the most gracious, the most kind. Ya Allah, Ya Rahman, accept all our recitation and our good efforts. Ameen. Ya Allah, Ya Rahman, You are the most, the one who loves those who repent. Ya Allah, Ya Rahman, we seek your repentance, forgive us. Ameen. Ya Allah, Ya Rahman, we beg you in your divine code, those people who have lost their lives, loved ones who are left this world, our respected Hafiz Ali Master, our respected, who was becoming a Hafiz, young Hafiz, 18-year-old brother, and also Brother Hafiz Minisab, who has worked tirelessly to basically help Noor Masjid and other mosques, has worked all his life, has lost his life. Another family member from the Munshi family from St. Paul's Road, and all over, Ya Allah, Ya Rahman, aunties, uncles, and fathers and grandfathers, they are all those who are left this world, Ya Allah, over 100,000 in this country alone, Ya Allah, Ya Rahman, and throughout the world, Ya Allah, Ya Rahman. Ya Allah, Ya Rahman, passed away with Iman, elevate them to the highest Jannah. Ameen, Ya Rabbana, Ameen. Ya Allah, Ya Rahman, Ya Allah, open their graves with gardens of paradise. Ameen. Ya Allah, Ya Rahman, Ya Allah, Ya Allah, Ya Rahman, grant the families sabr jameel ajr azim. Ya Allah, Ya Rahman, Ya Allah, bestow patience upon them, bestow ease upon them. Ya Allah, Ya Rahman, bestow, Ya Allah, Ya Rahman, ajr upon them. Ya Allah, Ya Rahman, the lost loved ones, Ya Allah, grant them the tawfiq, the ability to, Ya Allah, endure this pain, Ya Allah, Ya Rahman, and reward them in this life and in the next life. Ya Allah, those who are left this world, Ya Allah, elevate them to the station of martyrdom. Ya Allah, Ya Rahman, your beloved Rasul sallallahu alaihi wasallam has said that a person who dies in a pandemic, Ya Allah, Ya Rahman, it is as if he has been martyred. Ya Allah, Ya Rahman, Ya Allah, they have left this world, we are to follow them. Ya Allah, forgive them and forgive us. Ameen. Ya Allah, Ya Rahman, when it's our time to leave, Ya Allah, Ya Rahman, grant us death of the Iman. Ya Allah, Ya Rahman, grant us death with the, Ya Allah, afiyah. Ya Allah, Ya Rahman, give us life with afiyah. Ya Allah, Ya Rahman, with peace. Ya Allah, Ya Rahman, Ya Allah, we beg to you, your divine code, rid the calamity of COVID, Ya Allah, Ya Rahman. We understand, Ya Allah, this is your trial and tribulation, Ya Allah, Ya Rahman, but we beg you in your code, Ya Allah, Ya Rahman, we are weak, Ya Allah, Ya Rahman, so therefore rid all humanity of this illness, Ya Allah, Ya Rahman, and all other calamities and wars, wherever the war-stricken countries, Ya Allah, Ya Rahman, people who are suffering all around the world, Ya Allah, Ya Allah, Ya Rahman, remove all them calamities and difficulties, Ya Allah, Ya Rahman, and give us the ability to bear have patience and ease with these sufferings, Ya Allah, Ya Rahman. We beg you, Ya Allah, Ya Rahman, all the respected scholars and the respected medical doctors who have given the time, Ya Allah, bless them in this world and in the next. Ya Allah, protect them. They are our heroes. They are our frontline heroes, Ya Allah, Ya Rahman, whether it's the NHS, whether it's the carers, whether it's the old people home workers, or whether it's the essential shopping workers, Ya Allah, Ya Rahman, they are there serving humanity. So bless them in this world and the next. Ameen. Ya Allah, Ya Rahman. Ya Allah, those brothers and sisters who are taking part in this program, Ya Allah, Ya Rahman, we pray for them, bless their households. Amin, Ya Rabbana, Amin. Ya Rabbana, atina fi dunya, hasana fi al-akhirati, hasanat wa qina adhab an-nar, wa dakhil jannata mal abrar, Ya Aziz, Ya Ghaffar, Ya Rabbi, ja'alni muqim as-salati min dhurriyyati, Rabbana wa taqabbal du'a, Rabbana ghafir li wa li walidayya wa lil mu'minina yawma yaqum al-hisab. Ya Allah, Ya Rahman, या अल्लाह या रहमान, जिसकी सीधे भी दुआ के वास्ते या रब कहा कर दे पूरी आरज़ू हर बेकसूर मजबूर की, जब दबे वापसी हो अब सब के लब पर हो ला इलाहा इल्लल्लाह मुहम्मद रसूलुल्लाह सल्लल्लाहु अलैहि मुहम्मद सल्लल्लाहु अलैहि वसल्लम इन्नल्लाह व मलाइकतहु यसल्लूना अलन नबी या अय्युहल्लज़ीना आमनु सल्लु अलैहि व सल्लिमु तस्लीमा अल्लाहुम्मा सल्लि अला सय्यिदिना मौलाना मुहम्मद व अला सय्यिदिना मौलाना मुहम्मद बारिक व सल्ली अलैहि. آمين آمين يا ربنا آمين. سبحان الله يوم يصفون وسلام على المرسلين والحمد لله رب العالمين. لا إله إلا الله محمد رسول الله.